Please see the city clerk in the back of the room, and she will give you validated parking for the entire evening.
Stan? What's the channel button for?
These things?
Oh, over here it says channel.
Oh, I don't know.
Excuse me. All of you who just got parking validations from me, will you please check your pockets and whatnot? I have a number of them that have this writing on the back which tells me it came out of the meter when you pulled into the parking garage. You'll need this ticket and the one I just gave you to leave. So if you can, I'll wait in the back. Come see me if you handed me your garage ticket as well. Thank you.
Good afternoon, everybody. I'll go ahead and call our meeting to order. I think that we do have a quorum here. Shelley will plug us in. And we're off and recording. First of all, I'd like to thank the City of Las Vegas for accommodating us in making this room available for our meeting, and certainly want to thank all of the other jurisdictions that are working with the Health District and trying to find space and work on putting the Health District to work in this sort of a trying time. So that said, I'd like to check with council and see that the meeting has been properly noticed. And I believe we do have a proper quorum here this evening. So why don't we commence with Pledge of Allegiance, if you'd all stand. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. So just want to give notice that agenda items may be taken out of order at the discretion of the chair. The board may combine 2 or more agenda items for consideration, and the board may move an item from the agenda or delay a discussion relating to an item on the agenda at any time. First thing we like to do is bring forward Stavros Anthony for a Board of Health Service recognition.
It is on. Okay. Well, this is a recognition for Mayor Pro Tem Stavros Anthony. He has served on the board from July 2009 to this month, April 2012, for 3 years. He served as vice chair for this past year, and we're glad to have had his service here at the district, and know that he'll continue being a friend and supporter of the district, and we look forward to continuing working with him in his capacity as Mayor Pro Tem.
Thank you. Thank you, Dr. Sands, and Chair. I can't believe it's been 3 years, almost 3 years I've been on this board, and I have to say it's been an absolute pleasure working with you, Chairman Jones, and the entire board. The staff has been great with the Southern Nevada Health District. Shelley just does a great job, and Dr. Sands, and working with people like Annette and Glenn Savage and Dr. Maddow and Bonnie and Eddie, and I think I probably missed a couple other folks, but it's been very enjoyable. I learned a lot about some things that I didn't know much of. But as you all know, as elected officials, new people come on, you get moved to different committees. So I've been moved over to the Fiscal Affairs Committee for Metro, which is kind of my background, and you'll be in good hands with Councilman Beer. So thank you very much for this award, and I'm honored to receive it and appreciate it.
All right.
Okay.
So next we have some recognition for public health heroes for 2012.
Great, thank you. And this year, first of all, this evening, I'm very pleased to be able to present this year's Public Health Hero Awards. As you know, for more than a decade, the Southern Nevada Health District has honored organizations and individuals whose contributions have an impact on our community's health and well-being, and this year is no different. Public health, as you know, is a collaborative effort, and our staff continues to develop these important partnerships that help us meet the needs of the community. Again, I would like to honor this year's Southern Nevada Health District Public Health Heroes, each of whom encompasses one or more of the 10 essential functions of public health to help people live better, longer, and healthier lives. First, I'd like to ask Chris Ledbetter with Collaborative Software Initiative to come on up. Collaborative Software Initiative, or CSI, that you might have heard, has worked with our Office of Epidemiology since 2010 on the development of our Trisano system, which you've heard several reports about over the last couple of years. Initially, it was developed for the Utah Department of Health. The Trisano system has made a very large contribution to public health nationwide, not just here in Nevada, with its cutting-edge features. It allows, for us, for health district staff, it allows them to quickly investigate and understand infectious disease problems and patterns in our community. Our long-term goal is to adapt the system so that it can be used in our HIV, STD, AIDS, STD, and TB programs as well. And CSI has already made its development staff readily available to our staff to help us implement the new system features that are going forward. So again, I'm pleased to introduce Mr. Chris Ledbetter, CSI's product manager, and present Collaborative Software Initiative with its Public Health Hero Award. Thank you. Great. Thank you.
Great. Thank you also on behalf of the board. I know that project will bring good focus to the data that we got to work with.
Next, I'd like to invite Jeff Hahn with Boyd Gaming up to the podium. Jeff has worked with the Health District for several years, and he has developed Boyd Gaming's plans to operate points of dispensing or pod sites for its employees and guests for each of the company's Southern Nevada properties. The pods are part of our emergency response plans, so we can provide life-saving medication to everyone in Clark County, including visitors. And Boyd Gaming is the first local resort company with such a dispensing plan for its properties. And so I'd like to recognize Jeff Hahn from Boyd Gaming as a 2012 Public Health Hero for his extensive efforts in assisting the Health District in this regard. I'd like to invite Bridget Byrne with the UNLV Athletic Department up. And in 2007, the Office of Chronic Disease Prevention and Health Promotion initiated a program called the Coaches Challenge to encourage elementary school children to make healthy food choices and become physically active. In 2011, the program was relaunched as the UNLV Coaches Challenge. Head coaches Bobby Hoke, Jennifer Klein, Kathy Olivier, and Dave Rice became our partners and advocates. In 2011, more than 17,000 elementary school kids from 146 schools participated, and it was the program's best year ever. So accepting on behalf of the university is Bridget Byrne, the Director of Community Relations for the Athletic Department, and also DJ Allen, Senior Associate Athletics Director of External Affairs. Absolutely. And finally, I'd like to ask Judge Voigt to come up to be recognized as well. Many of you who know Family Court Judge William O. Voigt may not know how much he is a public health advocate as he tackles the issues related to public health in many ways. It is imperative that anyone who is a patient in our tuberculosis treatment and control clinic strictly comply with the treatment so they get better and hopefully not spread disease to others. The Health District does have authority to bring non-compliant patients to court, and Family Court Judge William O. Voigt has presided over 3 such cases. Judge Voigt has worked with our staff and has taken the time to educate himself about the disease. He has shown compassion for families and patients and has taken many steps to ensure that they are informed about the seriousness of noncompliance with treatment. His commitment to public health also includes his participation in the planning, development, and the forthcoming implementation of the Bench Book, which is an educational project that provides Clark County judges with essential information about public health statute and issues so that they can be responsive in the event of a public health emergency. So I'm very pleased to present to Judge William Voigt a 2012 Public Health Hero Award. Thank you very much. Take that. Okay, great.
So on behalf of the board, I'd just like to thank all of the community partners. The mission of the Health District certainly can't be accomplished without the excellent work of these community partners, and it really shows what can be accomplished when we all work with it together. Thank you.
Okay. Great. Just briefly, I want to present the Great Basin Public Health Leadership Institute graduates for 2012. They were introduced to you a year ago just as they started their program and they finished it. They expect to provide a presentation on their project at the May meeting next month. But I just want to give some recognition for them and introduce them to you. First of all, Marlo Tong with our clinics and nursing services. Marlo's there. Kara Bennett, also with clinics and nursing services. And Jennifer Harmon, community health. Jennifer here? Okay. And Chris Strickland with administration, with IT. And so they graduated just at the end of last month, and again, they'll be making a presentation next month on their project.
Congratulations. Do we have a new group entering in the coming cycle?
Unfortunately, the Great Basin Public Health Leader Institute is going on hiatus. Funding has gone away for that, and as well as the executive director, Joyce Goffin, is retiring. So I think, hopefully, we expect that it will come back at some time, but right now there isn't plans for another class.
Who was the funding source for that?
It was largely CDC was a major funder of that, and then each of the organizations funded it through the tuition that was paid for the program, as well as funding was received from the preparedness grant that the state receives. A small amount was also allocated for that, and over time, because of cuts, that has gone away.
Sorry to hear that, but thankful for the graduates that have gone through the program.
Great. Okay. I'd just like to call up Veronica Murata-Nichols, our Community Health Nurse Manager for Immunizations, to just do a brief presentation about National Infant Immunization Week, which began yesterday.
Good evening, members of the board. My name is Veronica Murata-Nichols. I'm the Community Health Nurse Manager for Southern Nevada Health District. From April 21 to April 28, it's Nevada Infant Immunization Week. National Infant Immunization Week is an annual observance to promote the benefits of immunizations and to improve the health of children 2 years old and younger. Since 1994, local and state health departments, national immunization partners, healthcare professionals, community leaders from across the United States, and the Centers for Disease Control work together through NIIW to highlight the positive impact of vaccination on the lives of infants and children and to call attention to all immunization achievements. Several important milestones have already been reached in controlling vaccine-preventable diseases. Among infants and adults worldwide, vaccines have drastically reduced infant death and disability caused by preventable diseases in the United States. In addition, through immunization, we can now protect infants and children from 14 vaccine-preventable diseases before age 2. In the 1950s, nearly every child developed measles, and unfortunately, some even died from the serious disease. Today, few physicians just out of medical school will ever see a case of measles during their careers. Routine childhood immunizations in one birth cohort prevents about 20 million cases of disease and about 42,000 deaths. It also saves about $13.6 billion in direct cost. In September 2011, CDC announced that childhood immunization rates for vaccines routinely recommended for children remain at or near record highs. Locally, the past 3 years, our immunization rates have gone up 10 to 12%. And that's hard work through different partners and through events like the National Infant Immunization Week. And the background of immunizations, before we give the shots, there's several things that happens, and you're looking at the very dedicated staff of immunizations. One is from our child care program, and we service about 566 daycare centers, and we visit and we work with them so that they can get their immunization rates up higher. The goal is to at least raise it to at least 20%. And then we have our Vaccines for Children's program, and we work with 155 VFC providers, and those could be pediatricians, they can be the pharmacists, they can be family practice, Nevada Health Centers, or any local health departments. And what they do is they visit and they make sure that the vaccines are safe for the public, and they make sure that they abide by the rules of the Vaccines for Children's program, and also a very good relationship and rapport, so that we also participate in the Nevada Information Learning Exchange, or the NILE program, that is done through our state WebIC or the immunization registry. And then we also have the adolescent program, which we work with 66 middle schools in Clark County. And with that, our rates when it comes to the school-age children is from 90 to 97%. So we are doing a real good job with that. But for our infants 0 to 3 is where our challenges lie. So this is, you're looking at the, like I said, very dedicated immunization advocates for Clark County. Thank you so much. Oh, we're going to ask you to, we're going to pass this for each of the Board of Health members. If you can put this in your offices. On Saturday, April 28th, we will have a big Passport to Immunizations and Health Fair. It's a no-cost shots, and it's event sponsors and community partners are United Way, Latin Chamber of Commerce, 100 Black Men of Las Vegas, 99.3 FM, and then Nevada State Health Division, and a whole lot more. So if you can remember us on the 20th, and if you would like to come, we would be more than happy to have all of you. It's at East Las Vegas Community Center. We're expecting at least 300 to 500 children. And we also, guys, we left you the T-shirts that we wear every National Infant Immunization Week. If you could wear that on Saturday, then you would be helping our cause. Our cause. Thank you.
Thank you for your work, and we can see that progressively each year you're getting a little bit more progress with it and having success. So thank you.
Thank you. Thank you. And it's to say, the immunization team does a terrific job, both in terms of administering immunizations, but also working with many other partners in the community, as you can see, to help get the message out and help improve immunization delivery wherever people might come in contact or be able to get immunizations in our community. Last, I just want to introduce John Lewis, who's a community health nurse supervisor, who will make a very brief presentation on Sexual Health Awareness Month. John? Oh, I'm sorry. Okay. I guess Patricia Glanson-Rourke will be here.
Good evening, members of the board. I'm here to talk about what the Sexual Health Clinic is doing for Sexual Awareness Month. Just a little bit background of the staff. It's comprised of 3 clericals, 6 nurses, 1 contract MD, 1 pharmacist, 1 medical technologist, and 1 lab assistant phlebotomist. The Sexual Health Clinic formerly was known as the STD Clinic, formerly known as the Venereal Disease Clinic. So you can see why but this work team is moving forward with a more positive image and trying to spread the word of prevention about sexual health. What we've done for our sexual awareness campaign this year is what we had planned to have students of nursing and pharmacists actually doing presentations in the clinic on a fairly regular basis to talk about the infections themselves and how to prevent them, as well as the medications. Again, for us, in addition to the treatment side of things, we're all about trying to educate people about their bodies and how they can prevent coming down to see us if they just exercise good judgment and take some preventative measures. The other thing that the students are really responsible for are updating our display boards that you would normally see in the rotunda of the main building as well as in the outlying clinics. The other thing that we are in partnership with is using the material supplied by the CDC, the Get Yourself Tested campaign. Rick Wright's team, the STD HIV surveillance team, really pushed that message out to those outreach activities that they have at Richard Steele and the Gay and Lesbian Center. And in the clinic itself, we wear the T-shirts and try to promote the awareness of getting yourself tested. Let's see, what else do we do? I guess we also, and this was the big thing, that unfortunately because of the closure of the building, we did plan for 2 mobile clinics this year. We were only able to successfully accomplish 1. Then the closure of the building happened. As a result of holding that one mobile medical clinic at William Pearson, we saw 16 people. 8 were male, 8 were female. Their ages range from 12 to 20 years. We had 3 outliers, one 37-year-old, one 41-year-old, and one 47-year-old. We're still compiling the data. We have one positive form of STI from that mobile clinic. Last but not least, I'm going to share our numbers at the sexual health clinic. We saw an unduplicated number of clients to the tune of 10,698. We saw 19,059 people who were duplicated. From January to March of this year, we've already saw 3,250 people. This past week, despite not having our regular home, we saw between the 2 clinics situated at East Las Vegas and Henderson, 231 people. To give you some comparison, for this same time frame last year, we saw 344 people. I really would like a round of applause for my staff who could not come tonight, but really deserve your recognition because they are truly a very dedicated group of people. And if you ask me any questions about STIs or STDs in general, I'm going to turn that over to Rick Wright because he can spew out those numbers for you. Anybody? Any takers?
Well, thank you for keeping the program going in the trying time we're in. So,
Thank you.
well done.
Patricia, you're also reaching out to UNLV and all the colleges and things like that, because UNLV, if you look at prescriptions written, there's a hotbed of things going on there with the dorms and the commuter
We have
students.
some marginal, because they have a student, I think he's referring to the Student Health Center.
Yes.
Yeah, and basically, again, we would consider them a provider, a private provider. So again, Rick might have some knowledge about that. But we let them do their own business because they're handling it really, really well. So.
Well, they're doing a great job, but they can always step it up further.
Well, we can actually reach out for them. That's a good suggestion, Dr. Christensen, one that I hadn't thought of, and possibly an alternate place for people to go, because I'm told, I don't have this verified, maybe Dr. Sands can, the #1 question of call-ins on Monday was, where do I go to get my STD problem taken care of? Number 1. Thank you.
Thank you again.
And again, I want to just thank Patty and her team. They do very innovative work in a very difficult and challenging situation currently, as it is, but they're very dedicated and very committed to carrying out the mission of both the district and through the sexual health clinic. And that ends the presentations for today. Thank you.
Thank you. So we'll go to section Roman numeral 1, which is our first area of public comment. A public comment period devoted to comments by the general public about those items appearing on the agenda. Comments will be limited to 5 minutes per speaker. Please step up to the speaker's podium, clearly state your name and address, spell your last name for the record. If any member of the board wishes to extend the length of the presentation, this may be done by the chairman or by the board by majority vote. And if you are going to present to us, please let us know what agenda item you are referencing.
Good evening, everyone. My name is Robert Ersey. I'm an environmental health supervisor with the Southern Nevada Health District and also a member of SEIU as a steward. My last name is spelled U-R-Z-I for the record. My address could be found at the Health District. All right, I'd like to speak about the item today about the new building or the building issue. Basically, it was brought to my attention that the building could be condemned through verbal notification to the Chief Health Officer on Wednesday, April 11, 2012. That gave Thursday and Friday, the 12th and 13th, to develop an exit strategy and a plan. Unfortunately, that wasn't done, and we had to be notified during the weekend. and scramble and basically get our plans into action. That being said, and if that was true, I mean, it was unfortunate that exit strategy wasn't developed before that, but I will say that in spite of all this, environmental health in particular has overcome a lot of these challenges. What I really like to say is that in environmental health, we have worked together under the direction of our director, Glenn Savage, under his leadership and his management team, which is excellent, Amy Irani, Steve Good, and Dennis Campbell. We have all pulled together in environmental health and continued with our mission in spite of these challenges and in spite of the lengthy delay that we got on relocation. I will also want to thank Ray Chua, our health card acting manager, and generously donating some of his space in the Henderson Public Health Center to allow us to continue our mission in environmental health. And it's this kind of teamwork, in spite of all the adversity we have overcome, to make us successful in environmental health. It is said that great leaders inspire greatness in others, and I will certainly say that of Mr. Savage and his management team, along with Ray Chua, that under their direction has really inspired the rest of us at the supervisory level and below to actually get our work done. It's unfortunate that some of our files and so forth, like in plan review, are still at the main, but hopefully we can retrieve those soon enough and continue with full operations. So again, I want to thank my division director, my management team, and I also want to thank the other division directors as well for their guidance during this emergency and actually getting the mission of the district accomplished. At the Board of Health, I thank you for listening to our concerns from the employees. I know that you hear from us a lot at every meeting, but I do want to thank you for listening to us and listening to the questions we have raised. And I think that you would see in the last several months some of the issues we have brought forward have proven legit, and we do thank you and your support and help on that. Thank you very much.
Thank you. Anybody else wishing to address the board?
Hi, my name is Carrie Evangelista, and I'm the VP for SEIU for SNHD. I will be commenting on the building memorandum admin monthly activity report and the EH financials. First, I would like to address the comment made by Member Tarkanian at the special meeting on the board's action toward the building. The employees appreciate all the board has done and the questions raised by the board in concern to the building. The issues we have are with Dr. Sands and Scott Weiss. Why in the last 5 years did they not ask for this study sooner? Why did they not ask for the study 5 years ago at the beginning of the building search? Why did Dr. Sands say that the building was not in danger in past Board of Health meetings? These were the issues, not the board's actions. Also, after reviewing the memorandum for admin monthly activity report in the agenda of today's Board of Health, it shows that Dr. Sands was attending committees, flying to Reno, and ironically participating in a leadership seminar during the week he found out that the building was to be condemned. Why were the employees allowed to stay in the building after the results of the report were known to Dr. Sands? Couldn't a subordinate have gone to these seminars in his place while he dealt with the building issue? This is another example of the out-of-touch nature of Dr. Sands by attending a leadership seminar instead of attending to the crisis of the building. Please, Board of Health, you can ask him about this and maybe he will tell you the truth. Also, why was there no exit strategy out of the building when it was known that the building was in bad shape? Also, during this crisis, the employees were made aware that Dr. Sands is not even acting as the incident commander for the SNHD. I'm sure that he has a good reason for this too, but we believe it is because he's an ineffective leader and has not really been allowed to be the incident commander. Also, in this same memorandum, there is a line saying that Dr. Sands participated in the Simple Truth exercise. This is an exercise involving other agencies and reviewed by the county. We have heard that Dr. Sands failed at this exercise as incident commander due to his lack of leadership skills. You may be able to find out more from Clark County administrators of this exercise. Also, to address the public comments sent in by email and read at last Monday's meeting about the building issue, first, I find it odd that public comments that are pro-management are being read to the Board of Health. Second, the union employees have never said that the building was healthy or in good repair. We question the search for the building and the lack of options of buildings being presented to the Board of Health by Dr. Sands and Scott Weiss, and the issue of Scott Weiss saying that to employees he was going to use the purchase of the building to lay off employees, specifically health card employees. Third, the union cannot be a union with only 40% membership. We must be over 50%. The next item I would like to comment on is the auditor's report of EH fees. We have heard that the auditors and Dr. Sands are reporting that EH fees were correctly audited under NRS 439. We are really confused about this since we have been reported to by numerous employees of Mr. Mars Patricio and the auditor stating that we have not been audited correctly in more than one private meeting. Maybe Mr. Patricio can speak on that issue. Also, in the last Board of Health meeting, the auditors seem to be trying to confuse the issue of the EH mishandling of money with indirect costs being charged to EH, and if that was allowed. While the calculation for indirect costs seems very shady and off, it is not the right to charge for indirect costs that is the major issue here. The issue is once the indirect costs were taken from EH, the money was dropped into the general fund and sent to inappropriate accounts. We understand that some of EH money should be used to pay for the administration division costs as indirect costs. We do not believe this is what was always happening, and it seems that the financial section cannot totally track where all the EH indirect costs have gone to in the other sections of SNHD. Okay, so they want to say that EH money was all the way used correctly. Then Dr. Sands should be able to show you the accounts numbers and the flow of the money for the last 5 years. Also, where is the interest that was made off EH permit money? Where's that? Where in the accounts is that? Again, do not let Dr. Sands confuse this issue as to whether or not they can charge for indirect costs to the EH division. This is not the issue. For example, we have heard that is, if you calculate all the money given from EH to, say, PIO, the money from EH overhead is equaling almost as all the salaries of the people in PIO. So how can EH be paying for
Your
almost
5 minutes is over, Kara. Can you complete this in about 20 seconds?
Yeah. So how can EH be paying for almost all of PIO's work? Again, this is not anything against any of the employees of Southern Nevada Health District, just the management level of Dr. Sands and Scott Weiss before he left. Thank you again for your time, and we always appreciate the Board of Health and all your questions and actions. Thank you.
Thank you. Any other person from the public wishing to address the board? Seeing none, we'll close that item and move on to adoption of the April 23rd, 2012 agenda. I believe everybody will have that electronically on your desktop. And I would entertain a motion to adopt the agenda.
Second.
Any discussion? All in favor of adopting the agenda? Aye. Any opposed? And the agenda is adopted. Next item is looking at the consent agenda. Are there any items that anybody would like to pull from the consent agenda? Commissioner?
Just a question. You said it was a flexible agenda, so at some point, if we're going to lose a quorum, we have quite a few policy issues towards the end of the agenda. Will you then move them up if that's the case?
We could do so if you wish to do so.
I'm just raising it. I'll make a motion to approve the consent agenda, but you also said we have a flexible agenda. When I look at some of the policy issues, some of them are towards the end, and it would make sense at some point if you feel we're going to lose a quorum that we take them out of order, if that's the case.
We'll do so, and if anybody needs to leave, please give us a little bit of notice, and
Thank you.
we'll do that. So, I believe we have a motion to accept the consent agenda. All in favor, aye. Aye. Any opposed? And the consent agenda has been accepted. All right, next item is number 3, to approve the voluntary furlough program. No, excuse me, that's all consent agenda. Next item is number 4, public hearings and actions. Members of the public are allowed to speak on the public hearing action items after the board's discussion and prior to their vote. Each speaker will be given 5 minutes to address the board on the pending topic. No person may yield his time to another person. In those situations where large groups of people desire to address the board on the same matter, the chair may request that those groups select only 1 or 2 speakers from the group to address the board on behalf of the group. Once the public hearing is closed, no additional public comment will be accepted. First item is memorandum number 17-12 to consider and approve the application for Boulder Sand and Gravel Incorporated to operate a solid waste management facility, a recycling center located at 3520 Losey Road, North Las Vegas, 89030, and take action as appropriate.
We have Mr. Walter Ross and Chris Johnson from our Environmental Health Division here to present on this item.
There you go. Is that on? Okay, thank you. Boulder Sand and Gravel, Inc. Has met the requirements for recycling center as specified in Section 4 of the regulations governing recycling centers. The solid waste proposed for acceptance is listed in the attachment A of page 6 of your memorandum and includes concrete, rebar, aggregate materials, and soils. Environmental Health Engineer Chris Johnson, to my left, reviewed the permit application, contributed to much of the plan review process, and followed through with the review and comment resolution. Staff recommends, therefore, that based on a final inspection that and subject to the conditions under the Part 3 recommendations of this memorandum number 17-12, that Boulder Sand and Gravel, Inc. be issued the permit to operate a recycling center located at 3520 Losey Road in North Las Vegas. Present today is Julie Walker of GWE Consulting and Jason Jensen of Boulder Sand and Gravel, and they're available to answer any questions you might have. Thank you.
So there are recommendations from staff. Are you aware of those recommendations and ready to comply? Yes. Anybody from the board wishing to ask any questions or have any comments? All right. Is there anybody from the public that would wish to speak to this matter? Seeing none, so we have a motion to accept. Do we have a second?
Second.
Any further discussion? All in favor, aye. Aye. Any opposed? None opposed. Thank you very much. Thank you. So next, we'll move on to Memorandum 18-12, which is to consider and approve application for Wolf Dropbox Services Limited to operate a solid waste management facility, a materials recovery facility, or a MRF, located at 5375 Cheyenne Avenue, Las Vegas, 89156, and take action as appropriate.
All right, thank you. Wolf Dropbox Services, Inc., Ltd. Has met the requirements of a materials recovery facility as specified in Section 4 of the regulations governing material recovery facilities. The solid waste proposed for acceptance is listed again in your attachment A, page 6 of this Board of Health memo. And those materials include paper, metals, plastic, glass, and construction, demolition, or C&D debris. Environmental Health Engineer Dante Merriweather, to my left, reviewed the permit application, and he's contributed to the application process and followed through with the review and comment resolution. Therefore, staff recommends that based on the final inspection, and again subject to the conditions listed on Part 3 recommendations of this memorandum 18-12, the Wolf Dropbox Services Ltd. be issued the permit to operate a materials recovery facility located at 5375 Cheyenne Avenue in Las Vegas. Present today is James Koff of Wolf Dropbox Services, and he's available to answer any questions you might have. Thank you.
Very good. So, Mr. Koff, there are some recommendations from staff. You're aware of those and able and willing to comply with the recommendations? Very good. Any comments, questions from board members? Any comments or questions from the public wishing to speak on the matter? If not, we'll accept the motion. Very good. All in favor, aye. Aye. Any opposed? None opposed. And you're off and running. Next item is Memorandum 12-12 to consider and adopt amendments to the Clark County Trauma System regulations or take other action deemed appropriate.
I invite Rory Chetlett, our manager for EMS and Trauma Service, as well as Mary Ellen Britt, our regional trauma system coordinator.
Good evening. My name is Mary Ellen Britt, Regional Trauma Coordinator at the Southern Nevada Health District. We are here this evening to present to you the proposed amendments to Section 400 of the Clark County Trauma System Regulations related to the addition of 3 new seats to the Regional Trauma Advisory Board. As recommended in the final report prepared by the American College of Surgeons Trauma System Consultation Team, the members of the Regional Trauma Advisory Board endorsed expanding the stakeholders involved in the trauma system by adding 3 new seats to the board at their February 15th meeting. The proposed amendments are as follows. Under Section 400.000 Roman numeral 2, the first amendment is under C1, where it talks about 1 administrator from a non-trauma center hospital system. The word system has been added as a point of clarification. Under still under Section C, number 8, 1 person with knowledge of legislative issues / advocacy. And I believe in your packet the language reads representing legislative issues and advocacy, but at our public workshop we were asked to change that wording to with knowledge of. Number 9, 1 person involved in public relations / media. And finally, 1 person with knowledge of system financing and funding. The final amendment is under Section 8, and that is with regard to the frequency of the meetings, that they should be held on at least a quarterly basis. It was changed from monthly to at least a quarterly basis. So the Office of Emergency Medical Services and Trauma System recommends these proposed amendments to the trauma system regulations, and I would be happy to answer any questions that you have.
Commissioner G?
Thank you. When did this board meet?
I'm sorry, which?
When did the group meet that made these recommendations?
At the February 15th meeting, and we had a public workshop April 18th.
Okay, and currently, where is this advisory board? Where was it created? I was trying to find it on our website. Where's the policies and everything that guides them?
The Regional Trauma Advisory Board?
RTAB, is that the right?
Yes, that's correct. It is in our Clark County Trauma System Plan, and also in the trauma regulations, is Section 400.
So it's in the plan?
That's correct, to have a regional trauma advisory.
So now
board.
we're adding people in while we're having the discussion about what to do with UMC, and the timing seems very awkward in my opinion. So what exactly, adding these people to something that we've never seen or heard about, what will that accomplish? What is the intent?
It was one of the recommendations of the American College of Surgeons consultation team that
so
we expand.
So was the issue of the pediatrics and the emergency room as well, and you haven't acted on that yet. So now we're acting quickly on doing something to add 3 people, but we've been sitting on their recommendations, not 1 recommendation, but 2 recommendations with regard to that. So where is that in this mix?
Well, actually, at our meeting last week, the recommendation to transport all Step 1 and Step 2 pediatric patients to UMC was endorsed by the committee.
And will that be coming before us?
That will go to the Regional Trauma Advisory Board, and typically we don't bring protocols, EMS protocols, to the board. In the past, historically, we have not done that.
So that still has to go to RTAB, which you're asking us to add people to today who will now consider that recommendation?
Yes.
Why?
Because, as I said, this was one of 81 recommendations, and they looked at our Regional Trauma Advisory Board and encouraged us to broaden the group of stakeholders involved.
Step me back then. Who was the group that made the recommendations, the 81 recommendations?
The American College of Surgeons.
Okay, the American College of Surgeons made 81 recommendations.
That's correct.
To the RTAB or the other group?
To the Southern Nevada Health District.
Okay, to SNHD.
That's correct.
And then, has this board ever seen the document from the American College of Physicians? Has that been provided?
Yes, it has
okay.
been.
And it made 81 recommendations. What have we acted on to date?
We have been in the process of acting on the recommendation that you mentioned previously about the transport of pediatric Step 1 and Step 2 patients to UMC. And as I said at the committee meeting last week, that was endorsed.
If I could, Commissioner, when we first got our recommendations back, we took them to our Regional Trauma Advisory Board. We began a process of prioritizing all 81 of them. This was considered one of the front runners of the things that needed to be done first. because the RTAB would be making recommendations on all 81 of them. And since one of their strongest recommendations was expanding the membership, we felt it was important to move on that. However, simultaneously, we also began to move on one of their other strong recommendations, which is the changing of the Step 1 and Step 2 pediatric patients being transported to the only designated pediatric trauma center, which we've done simultaneously, and as Mary Ellen said, was passed last week.
Okay, and so then this board, the RTAB board, isn't there another advisory board that's out there, the M something?
The Medical Advisory Board.
And the MED, who's on that and who gets appointed and how do they, who makes the actual final suggestions? You've given us lists of areas. Who makes the actual appointments? This board?
The Medical Advisory Board is set by EMS regulation. There's two sets of regulations.
Okay,
We have
maybe
our
that's-
trauma regulations, which you're reviewing here, which govern the trauma side of the EMS and Trauma System Office. And we have our EMS regulations, which govern the EMS side of the EMS and Trauma System Office. Our EMS regulations were passed by this board, and in there, the membership for the MAB is defined. It is the medical directors from each of the EMS agencies, as well as an operational person from each of the EMS agencies.
Okay, and that's the MAB.
That's the MAB.
And what is their relationship to RTAB?
Equal but opposite. If you look at an org chart, you have the Chief Health Officer of the Southern Nevada Health District, our Office of EMS and Trauma System, and both those boards lie parallel, one on the trauma side, one on the EMS side.
Okay, and so the one on the EMS side does the catchment issues then?
They make the final
Or do
decision.
they both
back.
They would
combine?
make, if it's an EMS protocol, the final decision is made by the MAB. But both boards may look at certain protocols, such as the one about pediatric patients.
Right.
We're asking trauma input, but because it's an EMS protocol, it'll be finalized by the MAB.
Okay. I think we need a flow chart.
If
It
I
would
could
be
just-
very helpful, because a lot of policy is done that we don't ever see, and I hear about it because of UMC, or because we get calls from which Medic West versus AMR and all that kind of stuff on fire department pickups and so forth. But I don't really have, I have to admit, a good handle on what each group does, who the players are that are on that. Do we appoint, or you make recommendations for categories, and then who does do the appointments then?
There is
For-
a selection committee. I'm sorry, Roy, I didn't mean to interrupt you.
Dr. Sands makes the ultimate final selection, but as Mary Ellen was going to explain, for the RTAB side of it, as you see in the regulations, there are descriptions of the individuals that should be represented. There are certain permanent seats in here, which is the trauma hospitals, the medical director and
The program manager.
program manager for each of the trauma hospitals are permanent seats. The rest of them are defined by regulation, and there's a selection process that's done every other year. We alternate certain members, so we're not turning the entire board over every 2 years. And so those members are then gone through a selection process where we go out to the community, we ask for interest, we accept their resumes or CVs, they're reviewed, nominating committee makes nominations, they go to Dr. Sands for his final approval.
Okay, none of that ever comes back to this board then?
Not other than through the regulations.
Okay. At some point, I would like a flow chart, I don't know if anybody else does, and then a regulatory process. And the issue with the UMC, which I did speak with both of you, and thank you for coming to the county meeting about, really was pediatric trauma and the impact of broadening. By allowing another hospital to go in and do that, it took away, it jeopardized our certification, but it also did not have the child getting the best care as quickly as they possibly could. It was being somewhat, sometimes they went to the closest rather than the one with the trauma. And so part of the recommendations from the College of blah, 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 was that we focus on the trauma 1 and 2s, but I don't have any of those with me. So was that the only recommendation that they made with regard to the pediatric? Was that the full recommend? I'm just trying to remember back.
They recommended that we look at adopting the national standards for the trauma field triage criteria. It's
Right.
an extensive document that talks about all the patients that need to be transported to trauma and under what circumstances. That is under review. Again, at the meeting last week, it was passed to use that as our guidelines for moving forward. It's a number of steps in there, as I believe we explained to you at the Board of Trustees meeting, that it was one of 81 recommendations. There's a number of them around that trauma field triage criteria. And we've made the decision to use that as our guidelines as we move forward. We also made the decision to transport the Step 1 and Step 2 pediatric patients to the only designated pediatric trauma center.
And so are there any issues still outstanding on that particular item?
Yes, because in there we have to, it's a guideline, and we have to go through that guideline line by line and make sure that it's appropriate for the care of our patients here in Clark County.
So by adding these three individuals who might sway or change the intent of what, I'm just concerned, I don't want to adopt something that then has another group come in that may change or object to moving forward on the trauma changes for the care of our patients and our clients, just because they may be more politically connected, or they might, you know, whatever the reason might be. We haven't acted on it to date yet anyway, which makes me wonder. I just don't want to put another barrier that doesn't move us forward. Trauma hospitals that have the experience, if you get that patient in there, whether it's an adult or a child, as far as that's concerned, it's not the time, it's the care that they are able to pull together because of the team that's there. And I just want to make sure you're not asking us to support something, or at least Mary Beth and I, to support something that all of a sudden impacts UMC in a negative manner, and then I hear from Dr. Fildes tomorrow morning, and I don't want to have to see him no matter what. So I just the timing of everything just seemed kind of, we couldn't act on the trauma thing for months, but now all of a sudden we're appointing 3 people to the board. And I just don't want it to become a group that then doesn't have us move forward on more of those recommendations on who should be receiving care.
Well, first of all, to clarify, we're not acting suddenly on one and not on the others. We've been doing this process since we received our report, and there's been a number of meetings where we've discussed this at the RTAB, and it was the RTAB's decision to move forward with expanding the board. If the board expansion was going to take place to provide us a better cross-section of the community, they felt it was better to do that ahead of some of the other processes, because you'd get that broader input as we made other decisions. So these 3 votes aren't going to significantly shift the voting membership around the board. So it was part of the RTAB's own recommendations to move forward with this first.
Okay, and that's, I'm not saying it, I just knew they met last week. I didn't know about February, and nor, you know, so in the long run, maybe we should get the minutes at least, so at least for those of us that are interested and nobody else is, that's fine. So at least I can't sit here and be any more ignorant than I am already.
They're certainly available, and we've had a number of meetings where when the document first came out, the report, that's the first thing we did is we prioritized. We sent all of those recommendations out. We asked the entire RTAB and the rest of the community around us to prioritize those. This was one of those groups that came forward first because of the importance to, if we were going to change a membership, it would be important to do that first before we tackled all the rest of the remaining 81. So that was the RTAB's decision.
And then how does Dr. Sands disseminate to see who's interested in participating or for appointment? Who do we communicate with?
Anybody in our office or through Dr. Sands, it'll get back to us. We do a very broad search for individuals. We send out to things like the Rotary Clubs, Kiwanis, AARP, obviously the hospital systems,
right,
the non-trauma hospitals, as well as trauma hospitals, our EMS community, our hospital community. We make a broad reach to seek membership. We have advertised in the newspaper in the past for particularly members at large. Haven't had a lot of success with that, but we do, every time there's open seats, we do a broad search to try and find more participation.
Okay, and maybe let us know. We can also send out notices to our constituencies. There may be email newsletters or whatever, and so we can always just pass on or put a blurb in our thing as well. I appreciate the board's patience with this question, because I know it's a late evening meeting, but I'm not going to do anything that jeopardizes or risks UMC plus the trauma care that we should be providing. So this was the first thing that came up on my radar screen, so thank you.
My perception is that it brings more comprehensive management to the whole system. I think what I heard last summer when the American College of Surgeons was here was that we had a very limited number of hospitals participating. You end up in a situation of sort of dueling hospitals rather than looking at where's the expertise.
Exactly.
And how do you manage to protect the expertise so they get enough patients to maintain experience and stay ahead of the process. So I think by bringing more community members to that gets us beyond the dueling hospitals.
I wholeheartedly agree, and we usually get the MAB minutes usually in our packets because I've been reading them. I don't know that we get all the the Trauma Advisory Board minutes. That could be amended so that that can go through in our
They're certainly
packets.
available on our website. But-
Yeah.
And thank you very much, because if you look at the type of membership we're looking here, we're really trying to broaden our knowledge base and help us make the right kind of decisions by adding these kind of members to our RTAB.
And Dr. Files was just finished his office of President of the American College of Surgeons on trauma, so it's his own organization making these recommendations.
Exactly.
Any other comments from the board? Questions? Mary Beth?
What is the number of members of the committee? I think I counted 10. Does it expand it from 10 to 13?
It's 14.
14.
And it will expand to 17.
Okay, thank you.
Mhm.
Any other comments, questions? Anybody from the public wishing to speak on the matter? Seeing none, you could accept a motion. So we have a motion and a second. Any further discussion? All in favor, aye. Aye. Any opposed? None opposed, and on we go.
Thank you.
Thank you. Next item is section number 5, report discussion action. First item here is petition 23-12, adoption of the SNHD budget for fiscal year 2013, or direct staff as appropriate.
Hi. Mars Patricio, interim director for administration, will present on this. This is, many of you have already, were here last month and received the briefing and then the presentation. Mars will go over that. There have been some changes or some tweaks to it based on some of the input we got, but also in light of the closure of the Ravenholt and the impact that that may have on our budget for the current year as well as for FY13. And Mars will be able to point out those areas for you and answer any questions you might have.
This is not the one, sir. This is not the one. This is not the right file. Michelle, how do we move forward? Okay.
He's asking, how do we advance it to the next screen?
Distinguished Chair, honorable members of the Board of Health, ladies and gentlemen, I'm going to be presenting the final budget. This is the same presentation that we have done in the previous month, and we just updated it based on the incident that we have in April 16 as far as the closure of the building. In preparing the budget, we make sure that the goals and priorities of the district is taken into consideration, such as meet all legal mandates, protect and maintain community safety net, minimize and prevent damage, preserve and protect the public health workforce, support both economic development and development of human resources, demonstrate fiscal responsibility, and leverage grant and alternative revenue sources when available. The factors that may change fiscal year 2013 budgets are the county property tax revenue, union negotiations, federal grants, and the facility requirements. Our final FY 2013 budget general fund are the following. The beginning fund balance of $20,157,249. This is based on the approved FY 12 estimated operating revenues and expenditures. Total revenues of $61,461,461. General fund expenditures of $70,654,660, and we'll explain later on the additional details on this one. Total transfer of $2,809,558, and we'll also explain the details of these on a further slide. a total expenditures of $73,464,218, and an ending fund balance of $7,697,492. This represents 10.9%, or around 1.3 months of fiscal year 2013 budgeted general fund expenditures. Just a note, though, the Southern Nevada District Board of Health approved a policy authorizing SNHD to maintain at a minimum unrestricted fund balance in the general fund of between 2 to 3 months, or 16.6 to 25% of general fund operating expenses. This is also true as a recommendation of the Government Financial Officers Association, commonly known as GFOA, which has 17,500 members in the United States and Canada. On the next page, we have the general fund ending fund balances between actual, approved, estimated, and the final 2013. I'll concentrate on the final 2013 budget. Opening fund balance of $20.2 million, total revenue of $61 million, operating expenditures of $70.65 million, capital fund transfer of $1.53, transfer to bond reserve fund of $1.28 million, an ending fund balance of $7.69. This ending fund balance comes from the audited FY 2011 Comprehensive Financial Report. I'm referring to the $28.33 million, of which $1 million is reserved encumbered balance. The next one is our general fund budget transfers. Capital Reserve Fund is budgeted at $1,526,461, and we will give you the highlights of the big expenditures later on. And we didn't transfer anything for the proprietary or the lab. Liability Reserve Fund, none also. But Bond Reserve Fund, we provided $1,283,097. This usually represents 1/14 of the amount of the property tax allocated to the district. A total fund transfer of $2,809,558. The revenue comparisons, we give you here 2 years of actual, 2010 and 2011, and budgeted 2 years also, 2012 and 2013. Of note in here is the Clark County property tax allocation, wherein in 2010, we have a total of almost $25 million allocated to the district. In 2011, it went down to 21.4, and then in 2012, it's 19.8, and in 2013, we're budgeted for $17.9 million. The estimate was provided by the County Budget Office. Currently, of the $19,870,482 budgeted for FY12, the district is only getting $5.69 million. The additional $14.2 million is pending litigation outcome. On page 8, General Fund Revenue Highlights, we show the net decreases from FY12 compared to the 2013 budget. On charges for services, which are made up of fees for services, we show a decline of 12%, regulatory revenue a decline of 3%, program contract services a decline of 14%. On intergovernmental revenues, which is coming from the state funding, it's 20% decline. Indirect federal funds, 1%. Direct federal grants, 67%. And this is mainly because of the CPPW, or Communities Putting Prevention to Work. We have in March of 2010 received a $14.6 million worth of grant from CDC for tobacco, and that has already expired in March of this year. Then in September of 2010, a 2-year grant also was received from CDC for obesity. This is for $3.8 million, and that will expire in September of this year. General receipts, our interests, we're projecting a decline of 50%, and Clark County property tax allocation is a decline of 10%. That is depending whether or not we will have a positive response in our litigation. On page 9, we will be showing the only place where we see an increase in revenue is on Title 19 Medicaid, an increase of 1%. On page 10, we classified revenue by type. So in FY12 in there, charges for services represent 43% of our revenue. And intergovernmental revenues represent 29%, general receipts 1%, and Clark County property tax allocation 28%. In FY13, charges for service remain to be the highest, which is 48%. This time, the second is the Clark County property tax allocation of 29%, intergovernmental revenue 22%, and general receipt 1%. On page 11, we show the pie charts, which shows different sources of revenue that we just discussed earlier. And of course, the biggest pieable, the sliceable, is the regulatory fees and the property tax allocation. On page 12, we have the personal cost. And what we did was we divided between grant and district, which makes up the cost. Also, we have budget for FY 2012 and FY 13. On the grants, between FY 12 and 13, there's a decrease of 616,930, or 6.3%. The district shows an increase of 905,110, or 2.1%. The cost includes a one-step 2.5% for eligible staff in compliance with the personnel code, as well as the collective bargaining agreement, otherwise known as CBA. Environmental health vacant positions not funded in FY 12 is also funded in FY 13. Also, estimated relocation cost of $240,000 is included in district's FY 13 budget.
That's in personnel costs?
That's personnel cost, yes.
So what personnel costs are associated with relocation?
That's related to the facilities for the movement of the different areas of the building to the new locations, be it in East Las Vegas, the Henderson, or the Annex.
So it's not per se a cost of salaries, it's a cost
Yes.
of moving the people.
Yeah, the $240,000 is the salaries cost and also related expenses. It also includes the IT or information technology expenses related to the move. And Angus will be discussing the FTE or full-time equivalents.
Good evening. Excuse me. Angus McEachran, Human Resources Administrator. You were given a packet that starts looking like this in your documentation tonight. And this updates a little bit what we talked about during the tentative budget adoption. The first page, which has the label on it 42312, up in the upper corner here, shows what our current staffing allocation looks like on a very general basis. In effect, what this shows is what our fiscal year 12 ending staffing allocation looks like. It's broken down by the divisions, and after each program is listed a number in blue. That number in blue represents the current number of staff assigned to that program. So it shows you what the allocation of staff is throughout the divisions as well as throughout the various programs in the division. The second page, which shows a date of 7/1/12, shows how that allocation would change in fiscal year 13. If you look at it, you'll see that there's only 4 numbers that are red. Those 4 numbers are the environmental health numbers where we're adding staff to environmental health in the fiscal year 13 budget. 1 in vector, 1 in plan review, and 4 in food and special programs. Prior to that, as we discussed earlier, we have a document that shows what positions were defunded so that we could repurpose them into the environmental health as we closed out fiscal year 12. That's the document that has the 4 big yellow lines on it. Those positions all came out of the administration division, and those positions were the ones that were repurposed into environmental health. That's how we end up with the situation of our staffing counts as shown in
I don't think we have
the
those.
documents.
If there's something you can post on the screen, that would help us.
That's them.
We didn't get the ones with the yellow bars.
You didn't, they don't have that. I'm sorry. I can read this one to you real quick.
The positions that were reclassified or repurposed into environmental health, there was an HVAC technician out of facilities, a security aide out of facilities, an administrative analyst out of finance, an administrative assistant out of finance. Out of the general administration section, there was an administrative secretary, and then on health cards, there was one health cards records assistant that was repurposed. There's one other position that's coming vacant between now and the first of the year. That's also in health cards, and that position is being repurposed as well into environmental health. So those are the positions that were repurposed under that program, which was one of the questions you had last time. Are any other questions I can answer?
Commissioner?
Repurposed is a new budgetary term, so is it basically what I would call a vacancy savings? There was no one in that position, but you had it budgeted?
Yes, ma'am.
Okay, so no body was there?
No body was there. We just transferred the funding from that position to the Environmental Health Division in this case, so that they could fill a defunded position from a previous budget cycle.
And you believe that that's why we would not have problems funding this budget, because if the depending on how the litigation goes, et cetera, you're asking us to encumber the district with 8 new positions, and then those will be rolled up, and then an additional 4 positions, I think, in nursing, but you're basing it on money that had been budgeted in 2012?
2012 that was also approved in the tentative budget for 2013.
So what impact will it have on 2014 then?
2014, the positions will be in the budget cycle.
But we may not have the money. I think we just need to know, normally you do a flat budget and then you decide where your roll-up needs to come into play. And I just don't want us, does EH need people? Absolutely. They've been saying that for months, same thing with nursing, for years actually. But I do think we need to be careful and cautious as we move forward on a budget, because we can create an obligation once those roll up. Just because it was funding that was there, it's no longer, that money will be expended, and then you roll that number up, and then it'll be 8 plus the 4. So I just think, I'd just be curious to hear some of the conversation from some of the board
Comment from Member Noonan.
Yeah, Mars, I have a question. On the previous slide, I'm like the chairman, I didn't quite understand the $240,000 in personnel costs that is associated with the relocation. Is this, can you kind of talk about that a little bit?
Yeah, on the relocation cost, we have a breakdown over here. From the facility side of the house, that's the guys that's going to be moving the furnitures, fixtures, and whatever to the new location. We budgeted.
So this is in-house staff that will be doing
in-house
that
staff,
work?
yeah, in-house staff. Yeah, we have a salaries of $152,000, and then we have related benefits of $54,000, and then also tax of $3,354. And then we also estimated that there will be an overtime of around $30,000.
So if these people weren't doing this relocation, they would have been maintaining the building, which there's nothing to maintain. So in a sense, there's not extra money out of pocket. They would be on payroll anyway, would they not?
This will be additional.
You're going to have to hire some new people or temporaries to do this work?
Jerry.
You're on.
Oh, Jerry Boyd, Facilities. I honestly believe that at this point in time, a lot of the costs that Mars is talking about has been recent overtime in relocating staff from the main facility to the outlying facilities. I also believe that this cost also refers to ICT staff as well. We've had to pack up many PCs, relocate them, pull wire, get them connected. In the future, wherever we go permanently, the facility staff most certainly is going to share in that process, and I believe that's where Mars is coming with these dollar amounts.
But if these people were not doing that work today, they would be being paid for some other work at the
Yes.
health district, would they not? So
Yes.
So the overtime would really be the only additional
Yes.
cost.
That's what I
So
said.
of the 240,000, 30,000 of that is estimated as overtime?
That's what I have on this calculation in here.
I think that possibly some of those calculations may be expenditures for additional lease space. So, I don't know.
Okay.
Mr. Chair.
Member Wood?
Going back to the other issue now, I understand too that environmental health needs positions, but at least 2 of them are coming from health cards. So has there been a decline in service need in the health cards area?
Yes, ma'am. There's been a decline in the number of cards sold in the process over the last couple of years, and we find that our current staffing is more than adequate. So as we've had a couple vacancies, we're not refilling those vacancies.
Okay.
Chairman. Chairman, what is that?
Yes.
Just a clarification on the numbers. The repurposed positions are 8. And if you look at the 2 pages, the 413 and 71, in the areas with red numbers, vectors move from 11 to 12. That's an addition of 1. Plan review moved from 11 to 12. That's an addition of 1. And food special programs, 78 to 80. That is 2.
Yes, sir.
And from my calculation, that is 4.
Yes.
Am I missing something?
Those are the 4 positions that are being funded out of fiscal year 13. The other transferred positions are already shown in the fiscal year 12 document. In other words, there were positions that were in administration or health records, and those numbers in the fiscal year 12 document have already been moved over to environmental health.
So in the fiscal year 2012, you moved, no, you're playing tricks on me again, go back. 2012, you moved 8. Can you go back to the previous page?
In fiscal year 12, we moved 7. We're going to move 7 positions. We've moved 6 so far.
No, yeah, okay, this page, page 13. You moved, page 13. You moved from administration 8 to environmental 8. And then 213, you are moving 4.
Yes, sir.
I kind of messed up with my mathematics.
We have 8 that are moving in fiscal year 12, and there's 4 more in fiscal year 13 for 12 total.
12 total.
Right.
Okay.
So I think, I mean, just the overall picture is the risk in terms of what's the likelihood of seeing the full property tax allocation coming forward and having some type of contingency if it were not to come forward versus dealing with it when the time comes to have to deal with it. And what I hear is we've got some people that would be hired, put into positions, start that process, and then we would have some risk relative to being able to continue the funding if we have problems with receiving the property tax allocations.
Well, sir, these positions are primarily supported by the fees that environmental health generates. These are not primarily property tax positions. They're regulatory fee generated positions. So as the environmental health fees have held steady, and we don't see a situation where they're probably going to go down in the near future. Glenn could talk about that better than I can. But my understanding is we don't see those fees income going down over the next few years. So we see these positions being supported by the fee income.
All right, good point. Commissioner?
Thank you. If that's the case, then they should have been funded all the way through when they were asking for the positions a couple of years ago, and we didn't get them that. I also think that we were told that they're actually losing money because of what we charge on indirect costs, so they're not any longer covering that because of what they have to send into the indirect cost component, to the tune of a couple $1 million. I just want to go back and understand the 240,000 plus is solely for overtime?
The $240,000 that we included in the budget, the breakdown that was given to me is that it's about salaries and wages of $152,450, friends benefits of $54,000, and tax of $3,003.
Tax?
Yeah, it's payroll tax.
Okay, so it's all affiliated with overtime, because I thought you just said there might be lease payments in there, and that should not be.
Yeah, the lease payment is not included,
Okay,
Commissioner.
because that should not be in a
Yeah.
personnel.
I will cover that on the next slide.
Okay, but this is all overtime.
This,
And
yeah, this is salaries and
is
wages.
there a budget
related.
that's planned out that would be provided at some point so we know how that is flowing? Because this will be expended pretty soon, I would think, or within a month or so, rather than being an ongoing cost.
This is the estimate for FY13. The one for FY12, which will be for the next 2.5 months, is a separate item itself.
So you think in 2013, you're still budgeting overtime for $240,000 for the purposes of moving furniture, IT, and so forth?
Yeah, moving to the new building, for example, or new
What new
facilities.
building?
New facilities that we are projecting in here that we will be needing around 45,000 square feet of space for medical clinics, so on and so forth. So based on that square footage, we're projecting the expenses that we will incur in moving equipment, supplies, and putting them together before the employees can move into that new space.
Which new space? Whatever we wind up leasing or doing whatever just for the temporary piece of the building?
No, we have two phases in here. One is for the current fiscal year, 2012. We are projecting that we're going to be spending $730,313 total until the end of June of this year. And then in FY13, we are projecting that we're going to be spending $1,777,000. That will include $929,250 for the square footage of 45,000 square footage of building space that we would be projecting to need. And included in that also is $847,800, which will be made up of mileage, supplies, fencing, storage, IT equipment that are below the 3,000 threshold so that they cannot be capitalized, as well as the overtime and the cost of labor.
Okay, so when you talk about the 45,000 square foot building, this is a new building, or this is what we might go out and lease on a permanent basis?
Yes.
But it may not be what we are right now.
Yes.
I have more questions, but I'll let him go through his.
Just to clarify, Commissioner, is that what we're anticipating is that in order to relieve, to relieve the displacement of people from, the main building, that, and we'll talk more a little bit later about what's happening, but that, we'll have to locate some space, temporary, lease space or temporary space to be able to, to locate those, those people so that they can be fully operational while we're, trying to work out a longer-term plan.
I haven't heard anybody definitively say that that 240,000 is overtime. It sounds like there's a lot of speculating going on. And I think the point that the chair made is a good one. Can somebody definitively say it's overtime, or it's all I've heard is salaries, benefits, and payroll taxes?
Of that 240,000, 30,000 is about overtime.
30,000?
30,000, yes.
So the other 210,000 is regular payroll?
Salaries and wages and related benefits and payroll taxes.
Not additional costs. Any other questions, comments? All right, let's continue with the presentation.
Page 16. On page 16 is our services and supplies, and we show in here that grant between FY13 and FY12 went down by $6,783,625, or 64.1%. The decrease in grant services and supplies is mainly due to the expiration of grant from CDC on communities putting prevention to work, otherwise known as CPPW, tobacco expiring in March, which has expired in March of 2012, and obesity expiring September of 2012. In the district, we show an increase of $2,286,599, or 21.6%, and included in that is a relocation cost of $1,537,050, which I have indicated earlier. And of that, $929,000 is related to the lease, and the others are salaries, wages, related supplies, as well as mileage, fencing, and storage. And then on page 17 is the total expenses, which includes both payroll as well as services and supplies. With grant, we show a decline of $7,400,555, or to 6.3%. And I have indicated earlier the cause of that decline, which is about CPPW. The district is an increase of $3,191,709, or 5.9%. And the increase in the district total expenses is attributed to increases in legal services, other laboratory services, other professional services, space rentals, and it also includes $1,777,050, which is related to the relocation expenses. On page 18, the Capital Reserve Fund major expenditures are $1 million, which we originally have planned for plumbing and restroom repairs of the old main building. But now I think what we're going to be doing is we will be using it for the relocation expenses for those items that are in excess of the capital expenditures threshold, which is over $3,000. And then we have $220,000 for the decade phase 2, $125,000 for replacement of switches, $100,000 for replacement of servers. Those that are $20,000 and below, we didn't include it in this presentation, but we have a list of all the detail in our final budget. Last page. On page 19, we have the Southern Nevada Public Health Laboratory Proprietary Fund, otherwise known as the lab. The total expenditures of $2,568,136, which excludes expense of $281,000 related to depreciation of equipment. A revenue of $981,691, which is made up of $887,791 from the federal funds distributed by state, $68,000 from general receipts, $25,900 program contract services. There is no transfer from the general fund that is planned for FY13 towards the proprietary fund. On page 20, we are showing you all the fund balances between general, capital, bond, or building fund, liability reserve, and the public health lab. On the first column, we have the general fund with an opening balance of $20,157,249, revenue of $60,654,461, interest earning of $350,000, expenditures of $70,654,660, and transfers outs of $2,809,558, with an ending fund balance estimate of $7,697,492. Capital Reserve Fund, beginning balance of $5,878,147, transfers in from the general fund of $1,526,461, interest earned of $55,000, and an expenditures of $1,526,461, with an ending fund balance of $5,933,147. The bond, otherwise known as also as building fund, with a beginning balance of $11,198,663, transfers in from the general fund of $1,283,097, interest earned of $140,000 with an ending fund balance of $12,621,760. We have a liability reserve fund, which is for our workmen's compensation fund, with a beginning balance of $679,191, interest earned of $9,300, and an expenditure estimate of $200,000 with an ending fund balance of $488,491. The last column is the public health lab, a beginning balance of $5,794,861, revenue of $913,691. There's no transfers for this year, $68,000 on interest earned, with an expenditure of $2,568,136, with an ending fund balance of $4,208,416. That ends our presentation for the final budget.
Further comments, questions from the board? Yes, sir. Mr. Beers?
Thanks, Mr. Chair. If I could draw your attention to, I guess it looks like page 1 of the packet that we had up here. It's got 4 columns. Looks like top line is opening fund balance.
Yes, sir.
The third colored column is, well, kind of purple to my somewhat colorblind eye. What color? Gray. Down there in that column on the revenue section, the last line of detail, county allocation, there's $19,870,482, but I think I heard you say that that number is false, that in fact at this point it's more like
5.6
14 million less than that?
Yes, sir.
And if I understand that correctly, then unless that 14 million shows up in the next 2 months, our ending fund balance this year is well below that required by our policy, and frightfully close to our statutory ending fund balance requirement. But of even greater concern is that if that becomes the case in the budgeted year, you end up with an ending fund balance of about negative $6.5 million, which is clearly below our statutory ending fund balance requirements.
You're right, sir. If we won't receive that $14 million in FY12, our ending fund balance would be $5,979,262.
And what is the statutory requirement?
The statutory requirement is 4%, and it's around $3 million.
$3 million?
Yes, sir.
So we'd be positive, we'd be above that line for the
FY12.
year end in 2 months' time.
Yes, sir.
And still negative for the year end in 2013. What are the board's plans to deal with that? There may be one. I'm the new guy here.
With your indulgence, sir, I would like to get the next slide, please. I mean the next file.
That guy's running away.
Turn enough to scare him.
The next file. Yes, please.
The one that was originally put up.
There you go. Go ahead. This is how it will look like, sir, if $14 million will not be received.
Oh, there we go. So I guess I'm a little perplexed how we're going to handle that.
I think the point is proper, that there's not an allowance for deficit type spending on behalf of the district, is there?
And I guess at the very least, I'd be curious what this is essentially accrual-based with probably, I imagine, some grants receivable increasing revenue and some accounts payable increasing expenses, but what's the impact of that slide on cash flow? At what point if this happens, heaven forbid, at what month in 2013 do we have an ending fund balance that is below the statutory limit? And at what point, is it 1 or 2 months after that we stop being able to pay bills and people?
I don't have that answer, sir, but I can come back to you with an answer.
Mr. Chair?
Yes.
I guess the question is, why are we being shown a budget that is based upon money that we at this point don't have? And until we know what the outcome of the appeal is, we really can't count on that money. And yet we seem to be basing all of next year's budget on the certainty that we're going to get money that we're not certain we're going to get. And that, I have to admit, concerns me. So why are we basing the budget basing it on the full allocation as opposed to what we've actually received?
On the next slide, ma'am, we show in there all of the funds, taking into consideration that we didn't receive the $14 million. And we have the capital reserve, which is $5.9 million in there. And then the public health lab, which is the last one, with 4.2. I think the chief health officer has the authority to make recommendations to the board of what we can do to kind of use those funds to address the challenge that we have.
Mr. Chair?
But I think the problem becomes that you're showing for estimated 19,874,82 as county allocation for 2011-2012, 17,970,540 for the tentative 2012-2013. And if both those years don't come through, because heaven forbid we lost on the appeal, I think we'd be in a serious deficit here. And there may not be enough to make that bump.
If we are not going to receive the one for FY13, that's an additional $12 million. I'm rounding to the nearest million.
I think one piece of it as well is the ability, let's say that the lawsuit does not prevail in favor of the health district. There is still the issue of what, that then puts, to my expectation, Clark County management in charge of what they're able to contribute or not able to contribute. And do we know what their projection is to what they would be able to contribute? We know what we would expect, but do we know what we think they might be able to contribute? Well, let's say, I mean, just as a what if there was no finding in favor of the health district, is Clark County going to be able to fund again $5 million the next year? Or zero, or what is it? Commissioner?
I think this year we allocated, was it 2%? Not the 3.5%?
It was about $5 million, I think.
It's about 5 million. I just don't know what that percentage, and I believe that George sent over numbers to you about 1.5%, or not. I think that's what you put in your budget originally, not the up to 3.5 cents.
I'm not sure, Commissioner. We just know that out of that 19 million, we will be receiving only 5.6 as we are receiving right now from the county.
Right, but I know that our financial people sent to the health district, this is what we would allocate this year based on what we felt we could spend and your needs were, and I thought it was 1.5%.
I don't have the number.
So you only budgeted based on, I know they sent money
Probably,
our
I mean,
numbers
dealing with
over,
it as
so.
a percentage is bulky. I would say dealing it with a number. If it's 5 million, 6 million, whatever the number is, would be.
And what they
something
did also, sir, is that they included also the building fund as well as the general fund together in coming out with the amount of money that is allocated to the district.
Because the capital fund is contained within that up to 3.5 cents, I believe, is why George did it that way. So 5 million is what we've told you for 2013 we were going to send?
No, 2012 is 5.6 million.
5.6?
Yes.
What did we tell you for 2013?
They haven't given us the calculation yet, Commissioner.
But you need it for your budget for May.
They just give us that we will be receiving up to the 17 million, 97540, but they didn't specify how much of that we will actually receive.
I have more questions, but I'll come back after you deal.
I think Mr. Beers had a comment or a question, and then we'll come back to Mr. Noonan after that.
Thank you, Mr. Chair. So this slide would make me think that we could reach the statutory ending fund balance in 2013. No. We could reach the statutory ending fund balance in 2013 if we swept the two funds, the two big ones here, which are creations of the board, thus can be uncreated by the board. Is that correct? We could undo the creation or transfer money out of these, either the bond building fund or the capital reserve fund, back into the general fund, and restore our cash balance to a positive number in the amount required statutorily?
That's my understanding, sir.
That is true. That is an option. Okay. But we don't want to do that. It would be like wimping out.
Well, I don't think that's the problem, but with the state of the building, I don't think you can wipe out those funds, because at the same time, we're planning on using those funds, I assume, for a new building.
They
can't be
that would be true,
double-purposed.
or we need funds for, if not, well, whether it's a purchase or a lease or something else, but yes, we need funds for a facility, whatever form we're able to acquire it.
Mr. Noonan?
I'd like to follow up on Councilwoman Wood's question, because I think it's a good one. And Dr. Sands, I'm sure when you put the budget together, you kind of had a backdoor contingency plan for what you were going to do. I think now's kind of the time to tell us, because the way I see it, we're deficit spending here without some kind of plan on the record of what we're going to do if these funds don't materialize.
Right. Well, before that, let me answer, Councilwoman Wood's question about, why we're using those numbers, and that actually that is what's on file with the Department of Taxation, because when we put in our Schedule B last year with a notation of, and they're aware of the litigation. Council certainly can speak about, how, how we document that, in our budget and Schedule B, and how that may impact, our position in litigation. I mean, and it is a tough situation to be in. I don't like being in it. Nobody likes to be in this situation. But it will require if the lawsuit if doesn't get settled to the favor of the district, then we will have to go back and significantly change this budget. And I'm going to have to come back and work with the board to bring some hard choices forward to the board in terms of programs and services, and which ones we need to maintain, which ones we may have, need to change up or reduce, and others that we may have to suspend for a period of time. I know this is I'm very uncomfortable with it. I know the staff doesn't like hearing this. Ultimately, though, you're right. If we don't have the dollars, we're going to have to go back and look at what can we do with the dollars that we do have to maintain our mission in the community. At the same time, we've always been working on in the background in trying to bring in other revenues from grants and so forth, and that, that's still been a challenge because of what's happening in Congress and everything, and the issues with the Affordable Care Act, that there are funds available, but people are, there's obstacles that get in the way of that. So, I know that doesn't necessarily give you a full picture, but that's basically the position we'd be in, is that we're going to have to go back and, work together, and, the board, management, staff, determine what we can do with the funds that we have.
Well, I think most of us on this board come from other jurisdictions, and, I mean, we've become very used to having to make these tough decisions. It's certainly been true in North Las Vegas. I know it's true in Henderson, Las Vegas, for all of us, Clark County even. But most of us, therefore, have been basing our budgets on worst-case scenario, and then hopefully things will turn out better than we anticipated, but at least we have the worst-case scenario covered. In this case, we seem to be budgeting for best-case scenario, and that's the part I think that I find scary.
And I would agree with that. I guess the other piece of it, as I said before, is that we also have in the background the litigation, and again, how we prepare our budget or what we document certainly can have impact on that. I don't know. Council may want to say a few words about that.
With respect to the litigation, the funding litigation, not the real property issue. The essence of the issue with the funding litigation is the interpretation of the statute. The Health District is saying that the Clark County has the obligation to fund 3.5 cents per $100 of assessed property tax value. Clark County is saying they have the discretion to choose how much they give us. The district is saying that, according to the statute, the district adopts their budget, approves their budget, gives it to Clark County, who by statute must adopt the budget and allocate. So allocate that 3.5 cents. So if we submit a budget that does not include that 3.5 cents, there's no obligation for Clark County to allocate that. So we would be conceding that they have the right to allocate whatever they choose with their discretion. If we don't even ask for it, how can we then say you're not giving it to us?
And I understand that, and I'm not saying that we should not ask. I firmly believe that that tax is being collected and earmarked for the health district, and therefore it should be paid at the full 3%. But at the same time, when it comes to budgeting purposes for this board, this is counting your chickens, before your eggs hatch kind of thing. I mean, to me, we are better off budgeting for a worst-case scenario, and better to receive additional funds than to budget for the best-case scenario and then find that something happens and we're not covered.
I understand exactly what you're saying, and I understand why you're saying it. There's no mechanism in the statute for the district to go back and get additional funding.
I think that that may be true on the income side. It may not be as true on the expense side. There's as much uncertainty, I think, on the expense side as there is on the income side. And one of the things that I sort of raised in when we had the tentative budget before us, is we really haven't, the depreciation of the building wasn't showing up in the budget. It's on some balance sheet in the background, and now our situation's changed somewhat, but it's no less precarious now. We still have a lot of unknowns out there as to, we're going to buy a building, what's going to cost to lease in the interim. We don't know all those things, and so you can certainly budget on worst-case scenario on the expense side, and maybe, that goes back to Mr. Noonan's point that we probably need to hear about where we're going in that direction before we consider adopting a budget that doesn't figure in all of those costs.
I mean, one model to consider even would be the factor of, and this is a lot of work in my mind, is to go with the budget as proposed, but it needs to be revisited almost on a monthly basis to see where we're at and what expenses have been accrued and how we're going into the next progression. But, that is month-to-month budgeting rather than an annual budget. Commissioner.
Thank you. I personally would not be able to support that because that would not be fiscally responsible, but also it would create a false expectation for folks about what we're going to do or potentially going to do. This, by April 1st, that the Health District has argued that they have to submit to the county their request. And that's part of what they've argued in the court case of we say it's up to 3.5, and they say, no, it has to be that amount. Whatever they settle, like, they had the hearing a month ago, I guess, or something along those lines. If that's the case, why are we amending a budget already? Because you can always make amendments and modify your budgets after you've adopted. You just need to come into compliance with what the state law is. And I know, I'm pretty sure it says we have to present a balanced budget as well. And I don't want to get, some of these cuts could be very dire in our programming needs. So I think we probably should be visiting a budget that reflects what our numbers are now and maybe hold off on some of the hiring recommendations that's being looked at. Do I think they need them? Yes. But that's a longer term obligation that's really going to tie us up, and then you have the rollover amount. I mean, even if you only have the 5.6 this year, say we win in the county, and next year we're doing about 17 million. I don't know what that percentage is. I don't know if it's back up or in the mix or whatnot. But even that is still not going to cover both maintaining your ending fund balance at the percentage that the board made the direction on, let alone some of the staffing components are there, and then the unknowns on the leases and so forth. I mean, I know we've got building availability, and we'll talk about this on the next agenda item. I know North Las Vegas does. There may be ways, that may be a whole nother opportunity for us to take a look at how we're going to locate. But I had some questions still, because we're not even talking about the CCPW. Goes away in September, doesn't it, for the obesity? And when does the tobacco one go away? That's gone. So those are grants that we had. And you zero them out. I think you've got them in there. But it's a lot of revenue that we utilize for programming is gone.
Well, and just for the CPPW, clarified for the tobacco, that, did end in March, but also CDC has provided a no-cost extension through September for, the unspent dollars, so we can continue with our partners, but that's still on a limited basis. And the other was, and what was built into this budget, as we explained during the briefings and last month's presentation, was that staff's done a tremendous job of building up our chronic disease prevention program, and so we don't want to just let these people just go away, because we expect and we know, we've been working on that that there are opportunities coming down for federal funding to continue for chronic disease prevention and health promotion. The team is already working on one grant through the FDA for tobacco control that is very promising, and we've learned that there's going to be a new FOA coming out for chronic disease prevention sometime in the next few months. So we've elected in this budget to program those positions in with the property tax dollars, with the expectation that once we get the grant funding, then we will move them, be able to move them on the grant funding, and that's one way that we're trying to preserve both the infrastructure but also the staff that we have.
And yes, you're right. When you start having good successes with these types of programs, you don't want to lose those community-based partners as far as that. I totally agree with you on that. That said, though, right now it's a budget exercise, and that budget exercise is we should be, I mean, my husband doesn't let me put in, I got to write the check based on what I've got, and if not, that's what I've got. And so let's answer the threshold question. Do we have to submit a balanced budget, yes or no?
Well, I mean,
the answer is yes.
I mean, yes, and I think the thing is and just, again, and I think this is what the intent was with Clark County, with the actions taken, was, to reduce that allocation with the, intention for us to, spend down
your reserves, which is what we've done with our Metropolitan Police Department budget as well. Because you don't create a savings account just to have money to save money, and there's a balancing act that comes in. So what's the percentage then, Mars, of what our reserve is right now? Our reserve is let me get to I've got too many different documents here, sorry. For 2011, 2012, bless you, reserved is 4.9, and we projected 7.6. Am I looking at the right column?
The estimate for 11-12 is 20,157,000.
But that's if they planned on getting the full money from the county property tax allocation. So that's what needs to be
So
backed.
without it, it's about 5 million.
Right.
Which would be 5 million divided by 70 million, whatever that arithmetic is, that's our percentage.
But that our ending fund balance had been what? Right. So
28,332,469.
Okay. And so because you didn't get your allocation, you started to go into your reserves because you had overbuilt it, in my opinion, but that was way more than 4%. And then the 20 million, though, is still based on whether or not you didn't subtract out the money you didn't get this last year. What would that dollar amount be? Is that what's back up here on the screen, the 12 million?
14 million.
Okay.
14,177,987 is the amount that we are not receiving.
And so for a contingency plan, I think for this budget year, we probably should be looking at a contingency budget rather than, or, I mean, not even a contingency budget, but we've got programs we can't fund right now, technically, between now and the end of this fiscal year. And last board meeting, we talked about the budget that had been done by Dr. Madal, which said, stop taking, you don't need all this money in the proprietary fund, which was the 4.8 million, which you're not making the transfer this next budget year. That'll be zeroed, but they're still sitting with the 4.8, which goes back to Councilman Beers's question. That money can be swept if that's what we need to have it swept. But this budget didn't even modify that, even though that discussion a month ago said to probably make those changes, other than you guys just didn't make the transfer.
The decision that was made was not to transfer anything for FY13 for the lab.
Right, but they're still sitting with a surplus
Yes.
that doesn't need to be there. And see, if we're going to come back with a budget that really is more reflective, you're going to need that money in order to be able to make your payroll. And then the other, what else did you say? Oh, then you would not make your allocation to the capital nor the bond this time, and then you could possibly use those dollars there? So you still have in this budget making the transfer, though, don't you?
Correct.
So about 2.5 million?
And that's something we can decide not to do.
See, that gets us 4, 6, 7, almost 8 million that might help offset, and we can actually come closer to having a balanced budget, which we should be. That's what we're supposed to put in by statute, I thought. And then we'd have to figure out, the 2013 is even more up in the air as far as that's concerned. I don't know that we're ready. I'm not ready to adopt a budget tonight, so I think they got a little bit more work to do.
Also, Commissioner, on FY12 estimated, there's 3,413,812 in their proposed transfer to the capital fund. The board may decide that they don't want to make the transfer.
Exactly.
And we have not made the transfer yet.
Okay.
Same
That
is
was
true also.
3.4 combined with those two. I thought it was 2.5. Okay,
And then
so-
plus the another 1.5 million also, the proposed transfer to the proprietary fund, that could also be
Also
decided
go.
not to be transferred.
That might get us to our balanced budget, ladies and gentlemen, for 12.
So the tentative budget that we approved a month ago, that was or was not submitted to Clark County?
It was submitted to them. However, after our meeting today, by tomorrow morning, we need to also submit over to them the final budget, because they will incorporate it with the county's budget, which is due to the state Department of Taxation.
And if we submit this budget, as you propose, to Clark County, we're not encumbered by that. We can still take adjustments as necessary if we don't receive funding in the future?
My understanding is there's a process of augmentation to change your budget, and I will have to double check on the processes that is
In the
required.
sense, I mean, last year we submitted a budget and ended up getting less funds than anticipated, and kind of in the circumstance that we're in today because of that. But I think from an operating standpoint, I mean, we would be telling the county what it is that the health district expects and needs to operate going into 2013 by submitting this budget. If we don't receive the funds, then we'll have to take appropriate action to address that.
I would argue, though, Fiscal Affairs presents one, all the budgets that we're required to incorporate, including the health district's budget. But each individual entity still has a requirement to present a balanced budget. And so what you may be arguing is to give us an unbalanced budget and give us a budget betting on the come, and granted, we're a gambling state, but that's not how we should be determining our community-based programming. And in the long run, it would be more reflective because you can amend your budgets as many times as you need. If we lose in court, then we make the full allocation, we'll have to amend that budget as a board. So you augment as many times as you need. You can also decrease in some areas. But the budget here is not reflective of what the situation is right now. And that, to me, is the most prudent way to be able to go. And I think by even just not making those transfers and taking a little bit out of the SNPHL, you've got the balanced budget, at least to reflect the cuts or the lack of what we sent this time around, at least for 2012.
But just so I understand, if the health district does not request of Clark County the full amount that is estimated to be due for property tax allocation, then Clark County would not be obligated under any scenario to provide those funds.
That is my understanding of the statute.
But that's what you argued, and that's what you've argued in court. If that's the case, why are we amending this budget tonight? If it was that they had to get a budget to the county by April 1st, then what are we doing amending this tonight in any way, change, or form? Because you've made some changes to it from what you submitted to us in April, correct?
The tentative budget that was approved last month
Right.
was the first schedule B that we...
But this one, even in front of us right now, has changes to it, correct? So you've provided to the county April 1st. If your argument is that you can't change anything else, then you've presented to us on April 23rd now a modified budget. May not reflect everything, but it's changed. So either we can change it or not.
Mr. Chair? Annette, is there some guidance that we can get from the state on this issue? Because I do understand that we have to ask, because the initial lawsuit did go in favor of the health district, and we want to maintain that entitlement because we believe we are entitled to it. And so I understand that point. But my fear is from the state perspective, and not from a legal perspective, there is the issue of the balanced budget. And I don't know how you balance when we're reflecting what we want versus what we've actually received. So perhaps between now and the next meeting, can we get some kind of maybe guidance from the state to tell us how do we handle this without losing our legal entitlement and making the request that we believe we are entitled to, but at the same time make sure that we also meet the entitlement to balance the budget as it is.
What occurs if we don't take any action on this budget tonight?
I'm sorry. Oh, it's on. Yeah, we will not be able to meet the deadline as indicated, because supposedly the deadline was April 19. We were already given an extension by Jeff Scher, the controller of the county, to provide it to them as early as tomorrow after today's meeting. So if we don't approve this budget, then I'll have to tell them that, we don't have an approved budget.
And the changes in this proposed budget, amended budget, relative to what was approved in the first budget that we did a month ago are the expenses relative to moving into a temporary building. And because we already did budget for these new positions or the transfer of positions that we talked about, that's not
Correct.
different today than what we approved once before.
Yes.
So maybe just highlight for us once again, I know it's getting complicated, what is different about this proposed budget than what we proposed before?
The difference between this, the major one is, of course, the $1.7 million that we added in for FY13 in relation to the move because of the closure of the building.
And
The revenue didn't
essentially
change.
everything else is equal to what we had approved once before.
Almost, yeah, almost all of them.
So there's our dilemma.
And which funds do we have discretion to pull from mid-year? Can we in fact take out of the bond fund and without jumping through legal hoops or without going back and changing our budget?
If I understand your question, the board has the authority to transfer the funds from the bond fund, the capital fund. Those are non-restricted funds. So the board would have the authority to transfer funds, to approve transfer of those funds as they needed to. Is that the question that you were asking?
Yes. And so this deadline that we have tomorrow is for the 2013 budget, right?
Yes.
I mean, whether or not we get the funds that we're asking for from the past year has no bearing on the 2013 budget other than just changes the starting fund balance going forward, right?
Correct.
So it seems to me that in any kind of budget cycle, you're always speculating what kind of revenue you're going to get, somewhat. I mean, you project based on past numbers, but it's not a science, and that's true of whether it's coming from the services you're providing, whether it's coming from grants you're asking for, or other revenue sources. So I think it's incumbent upon us to get a budget out there. As long as we have mechanisms to change it, I don't want to come back every month and revisit where our budget's at. But we have to have funds available to pull from other sources to the extent that we need those. And it sounds like there is money there that would at least get us through 2013 if we had to pull it. I would like, though, to see, some going forward, some kind of planning as to what the worst case scenario is. Where are we going to pull these funds from if we don't get the county funds? We need a plan of action in place so that we don't get to that point if it happens, and then we don't, we're still throwing our hands up in the air and not knowing what to do. So I guess my opinion would be, given all the uncertainties on the income side, given all the uncertainties on the expense side, we still need to get a budget in place, and I think we ought to do that. But I think we need to start looking hard at where the funds are going to come from if we don't get these county funds. And I do still think also on the expense side that, and maybe you're going to speak to that tonight, we need some definitive numbers in front of us as to what it's going to cost, both in the short term and in the long term. If we don't have the luxury of waiting much longer to flesh out these plans. I mean, if we're going to buy a building, we need to get to that point. If we're going to lease for a couple of years, we need to know that so we can start looking at these numbers and what they really mean to us, and start moving funds in if we need it, or proceeding as we planned in our budget if it works out that way. But we need to know where staff thinks we're going to go in the short term, and we need to know it relatively quickly.
Is there using, I guess, the gambling term, an over-under on when we think the Supreme Court would be likely to have come with a decision? I mean, what's the outside limit? Could it be a year, 2 years, 6
No,
months?
Worst case, I would say fall.
And we
But
think with this budget, we might get through the first 6 months before we really have a very troublesome situation?
it's entirely possible that we could get the opinion sooner. And I say that solely because the court, well, gave us the expedited briefing schedule. They gave us an expedited oral argument schedule. And that said that I interpreted that as meaning that they understood that this was a local government. We have budgetary deadlines that are coming now. And so given that, my expectation is that they would expedite the opinion itself as well. But my crystal ball is not working. I don't know if that's going to be
If the health
actual.
district prevails, is that the end of consideration, or could Clark County ask for some further review?
They could ask for further review, and they could subsequently appeal that.
Oh, good.
Would that require going to the U.S. Supreme Court or Ninth Circuit, or where do they go?
I believe they go to Ninth Circuit. The Supreme Court? This is federal court. This is state court.
They're not going to the federal court.
Yeah. Supreme Court. They could do a writ.
My personal opinion is that even if we get the 14 million extra both years, we still need to start looking hard at balancing the budget going forward, because I don't think that gets us where we need to be. It gives us some breathing room, but I think we need to move sooner rather than later towards how we make this thing balance out.
Mr. Chair?
Yes.
I guess we need to maybe, in my mind, split this just a little bit, in that I feel somewhat like today's discussion is a way for the district to make their case that they were stuck having to tell the county, here's my budget on April 1st, and then that they've always, their expectation was the 3.5%. And if they modify anything from what Annette said, then it'll be perceived that maybe they're tying in more to our argument, which is it's up to 3.5%. And maybe part of the discussion's always been, or lack thereof, is that justifications for the budget were never submitted. It was just, give me the 3.5% of what that value is. And then with the budget crunch and everything that everybody suffered through, we gave it a good hard look, and our fiscal people said, no, we're not giving you the full 3.5%. So that's kind of the argument on that side of it. That's for 2012. The budget you're asking us to look at right now is 2013. And you're asking us to compound the problem just to get something to the county. You already gave them the tentative, right? Okay. You can do a cover letter and say, this is the tentative, there's modifications that need to be made, we're in this position, the county's in this position, whatever it might be. Or we make some modifications we ask for another extension from them. We don't have our hearing till May, right, Mary Beth? So maybe we can do another extension for you and come back with a modified budget for 2013 that actually reflects the correct numbers. Just to get something on the board, you've started that part of the process. To me, that's not an excuse to adopt something tonight that's not really fiscally sound. And then I go to, how come we didn't have a copy of what's on the screen here in the screen numbers that Mr. Beers asked you about? You had it, but we as a board didn't have it, which makes me feel like everybody kind of knew there wasn't any money in the budget, but we're not going to tell the board that. Now, maybe that wasn't the intent, but we don't have that document. Why is that?
And we can provide that document to you.
I know you can, you just did to the general public, but not to the board, and it wasn't part of our budget packet or budget information. So it makes me feel that you didn't really want to tell us the whole story.
This may have been presented to us once before. I don't know if that's the first time I've seen this. Certainly, we don't have it in front of us tonight.
The budget that was presented to us and everything that was gone through the screen was as if we had the 17 million, as if we had the full dollar amount, and then mysteriously, one page appears that tells the real story.
Mr. Mears.
Thanks, Mr. Chair. Since I last worked with the commissioner, I've become a certified fraud examiner, which in my world is promulgating misinformation deliberately. And this budget meets my definition. I can't support it the way it says. If we wanted to come back even in a week and approve a revision, maybe we can work it out here in front of the board, I don't know, and approve a revision that reflects what we now know to be the reality. I can't support moving this thing as it sits now.
Are you suggesting we change it to eliminate the 14 million, or were you suggesting other changes?
Well, I think the only way I've heard to eliminate the deficit tonight is to pull the money back out of the two funds where it's been put. In 6 and 7, their capital reserve and the bond building fund. That appears to be the only thing I've heard so far that resolves the problem. I guess if we don't have a statutory requirement to submit a balanced budget, the other alternative is to not pull that money out and submit a budget that has an ending fund balance in 2013, fiscal 2013, that's negative. Either one of those, I think, would be an honest portrayal of what this organization is currently experiencing and where it wants to go.
Mr. Chair?
Yes.
And I guess that gets back to maybe we can ask the county for an additional extension based on the questions that we're having. And that's where I think we need to get some guidance from the state and what the expectations are. I don't know that we're required to send the balanced budget to the county, but I know the state's requiring that part. And so that's where I think we need some guidance and directive to meet both the county's requirements and the state. So even if we have to call a special meeting, I think we need to get the guidance before we move forward, before we make some fiscal error that I don't think any of us want to be part of making here.
So am I correct in that what this is boiled down to is whether we're going to reflect the 14 million that we think we're entitled to, or we're going to reflect going forward the 14 million that the the 5 million that the county has said, this is what you're getting. I mean, that's what we've come down to, and then we're sitting here having a discussion about whether we're supposed to, which one we're supposed to utilize.
Well, I think the problem is that basically we're being told if we don't ask for it, then we may find ourselves legally not getting it, which we certainly don't want to leave ourselves in that situation. But on the other hand, from the state, we have to provide a balanced budget, and we cannot do that by basing it on ask numbers versus actual. So that's why I'm saying I think we need to get some clarification here on whose requirements are we trying to meet, the state's requirements, and how does the legal case play into that?
Well, there's got to be, I'm just assuming there's got to be a rule as to whether you're asking. I mean, this can't be something that no one's ever addressed before. I mean, you know, we're having a conflict over how much we get in, and so we need to know, I guess, how it is you are supposed to, under the law, reflect the conflict. So, I mean, I guess I don't know.
Could there be a budget line item here that is the contested amount?
Yes.
And that would be sort of descriptive of what is expected versus not yet received.
Presented over here. But if we're going to do it for fiscal year 2012, shall we do it also for fiscal year 13? So that means to say we have to remove $12 million in fiscal year 13 also.
Well, right now, I mean, at this point in time in the budget process is to ask Clark County to provide the 23.5 cents per hundred, whatever that total amount is, and they've not denied it. They denied it in 2012, but they haven't even heard about it, let alone denied it for 2013. Would that be a fair statement?
So what I'm hearing is that if they have deducted $14,177,000 in fiscal year 12, there's a great probability that that will be deducted also in FY13.
We don't know that. I mean, that's possible, but we don't know that.
So the question then is, how would we present FY13? Shall we present as is, or?
Well, let's hear from Mr. Beers, and I'll give you my thought on that.
Just one man's opinion, and it is pending resolution with the propriety of this idea with the state, but I would think that you could have in fiscal 12, we've got the screen up, right? The total revenue line, well, this is a little different than the first slide, but I would think that the estimated column here, the third column, the total revenue line would drop down by the 14 million that they're not funding, 14,180, I think. Which drops the ending fund balance. Oh, this has it already.
Yes.
You know what? If you change the caption, property tax allocation adjustment, to property tax revenue, contested property tax revenue expected pending resolution of court case, with a footnote explaining what that is, then I think it's reasonable to present that as a separate line item in both years, if you wanted to maintain the integrity of what you're trying to contend with your budget, and you are truthful and forthright, and nobody can argue with it. The question is, can you have a contingent revenue item that balances your budget? And I don't know that I ever ran into that question when I was in Carson City, but maybe.
I think it's always contingent, isn't it? You never know what you're going to get.
Good point.
I would support something like that, just in the interest of moving it forward. You're not going to get an answer on your court case in time to do anything with this. I really don't think the state's going to provide much guidance to us. So I don't think we have much alternative. I like the idea of separating it out just so it's clear what it is, but we all know it's contingent. It's been vetted in public, and then we move forward.
And if we move forward,
Commissioner Scow.
And I would agree with that. I had the same comment. I'd like to see a contingency, even if it weren't turned in to the county, that we would have it as a board, so we could see what a plan would be without the 14 million.
Anita?
Oh, that was basically what I was going to say, that if we're going to do it that way and we show the contested amount separately, that we still have some kind of contingency plan. Whether we provide it or not, we can certainly determine, but something that's there so that we are covered to say we have a plan in place in case we don't receive those funds.
Mr. Chair, just for clarification purposes, this page 2 then would become the attachment to the budget with that modified language on it, instead of saying the property tax allocation, but a contested contingency or something along those lines, correct? Second thing is, what we still haven't resolved then is for the 2012 and the 2013 is you also have staffing increases that you've recommended, and we need to still address that, because that's going to become a further encumbrance depending on what you do on your shortfall. And maybe it's a delay, not hire till after July 1st or something along those lines, but that, otherwise we're.
One method of protecting that is to not fill those positions until there is some resolution. I mean, they're in the budget, but don't fill them until there's some resolution.
We could do that for the 2012 as well then.
Right. Mr. Beers has a comment.
Thank you, Mr. Chair. I guess now that I look at this, while I'm not talking, it makes more sense. And I didn't quite describe this right. This isn't quite exactly there. What you're doing here is reporting the total revenue at what we would hope, and then backing out the portion we haven't been paid, I think, for 2012, is, if I'm understanding this. So the final product will look a little differently than this, but conceptually, I think everybody understands where we might go with this. which is to break out that revenue component from all the other revenue and title it a contingent item with a footnote that describes the suit so that no one over there at the county is confused by what we're doing, and move forward with the budget that way. And as long as we do it that way in 12, I don't even think we have to necessarily break it out in 13, but we could. We haven't had that dispute yet technically. I think I heard you say at one point that you've not received communication from the county as to what they're planning to allocate to us in fiscal 13. As far as having a contingency plan, I don't know that the law requires us to include that with the budget, to make a statement that we have a plan in case this doesn't come through. I don't know. We're kind of charting new territory. But it's clear, I think, to the board that we do have a contingency plan, and that is to raid the money we've set aside in our savings account, pull it into general fund, and spend it on operations, which is never a good thing to do when you spend what's effectively one-time money on operations, but that would give us a year to figure out either where to find other sources of funding or where to reduce spending.
Mr. Chairman,
Yes.
I don't think it makes a lot of difference whether we wait or not. I think we should go ahead with it, just as a number of the other board members has said, because we do have the ability to change the budget, to alter the budget later. We don't know whether we're going to get the money or not going to get the money, but I think at this point in time, I would agree with a number of the other board members down there that we go ahead, and obviously I think it's critical that we do make a notation. In fact, in Mesquite 2 years ago, we had to go through something very similar where we actually sent the state a statement with our budget explaining why we had done what we had done, and there was no problem with doing that. So then if the courts come back with a negative for us, then immediately we can go ahead and make the adjustments we have to make. I think it goes beyond just rating it, though. I think if that's what happens, I think we're going to end up making some hard decisions. I think somebody used that terminology already. We're going to make some hard decisions on what services we're going to be cutting. Hopefully that isn't where we end up. So if we've had enough discussion, I would be willing to make that a motion. Unless there's any other further
try
discussion.
to put the motion into succinct words.
Well, one more question, Annette. If it's listed as the 14 million is listed as a positive, but noted that it's disputed, is that doesn't hurt us strategically, does it?
The 14 million, the 14 is what we would be expecting.
All right, so it's just listed as
With
being
just a footnote.
disputed in a footnote.
And I think that's similar to how we had footnotes in last year's budget, and I think that's how we described it.
So I'll try the motion, but I think on the screen that's before us, the 14,177,987 would be not listed as a negative, but it would be listed as a positive and noted as being disputed. And I think you'd.
And the 68,994,783 above will be reduced accordingly?
It would stay the same.
What that is?
Well, maybe we need to go back to the original screen, the budget that we saw first.
This one. I think they've got an overhead camera by the next microphone over. If you set it out there, they might be able to pick it up faster than they're trying to find it in the tower. That's the one. Nope. Yes, that one will work. So, Mr. Chair, with your
Please.
permission, I think if we took the third column of the slide that's on the screen and broke the 68.99 out into one line that is 14.18, which is our contingency revenue for estimated fiscal year 2012, and the total revenue number becomes something in the neighborhood of 54.8 or so, that gets where you want to get.
And then we don't
And
even
then you
need to
could
list
break-
it as contingent, we just list it as disputed.
Disputed, yeah. And a footnote that we've won the district court case.
Right.
So we have a motion to that effect?
And if I just might clarify, then what would you do with 2013?
I would say what I've heard is we would continue to ask for the full 23.5 cents for 13. The county has not indicated that there would not be a provision of that. At the same time, they haven't said there'd be a provision of anything, but we need to ask for it.
And I disagree, and unfortunately, I was going to be able to support the first part, but I'm not going to be put on the record to say that that's the game that's being played here, because I think that's what we're being asked to do, is to help your strategy in arguing your case, which I'm not going to
Well,
do.
do you want to put it in terms of argue or contested funds for 2013? Because they have not yet been contested.
Yeah, they are. They're all part of the same thing, because we haven't allocated the full 3.5 cents, and that's the whole issue. The
It may
assumption.
be that Clark County makes a decision to fund the full amount in 2013, and don't know that they are or are not able
I
to do so.
don't either.
They haven't commented as to their ability to do so.
If you don't break anything out there, though, then if just average citizens looking at this, they're going to think, oh, they got all this much more money that's going to come in the second year. Staffing's going to be forgotten, and you need to put your asterisks on with regard to not doing your hiring part wherever you need to do that part.
Well, then add another asterisk with the footnote that says all or a portion of this may be disputed. There's no way you're going to get around, it's circular, we're going to keep going around the same issues if we don't adopt something, so.
Sure, I would go with that. Thank you, Rod.
And then, Mr. Chair, we also have the issue of the modification to the tentative budget that was approved last month, the modification that's before us this month, which also should be incorporated into this motion, I would think. Mr. Maker, you want to take a shot at that?
I believe it was this, oh, go ahead.
If we don't receive the funding, we're going to have to make a modification anyway, so we're going to be making a modification on it, one way or the other. And I think it only goes without saying, if you're going to say that we're going to be receiving the full funding in 2012, how could you not put it in the 2013 budget? Because the assumption would be that's what you anticipate was going to prevail in the court. You may have to adjust them both later, but it wouldn't make sense, there's no logic to putting it in the 2012 and then putting a different number in 2013. We don't know what the number would be, obviously, because we don't know how much tax is going to come in, but I mean.
What I hear is a motion to approve this budget with this information, with the addition of adding a line for the contested funds and a description of what that contest is about. And if we go forward with that, we'll have to watch our budget over the course of the year as we normally would anyway, as to what funds are arriving and when they're arriving.
And is that an asterisk on both years, or is that only for the 1 year?
We just leave it.
Would have to be an asterisk on both.
I would think so, but I'm just,
So I've heard the motion as presented by Rod with regard to the presentation of the information with an asterisk and the description of the contested funds. And if we have a second, we could go ahead and vote on that.
May I ask one question?
Yes.
Now, is that including, we talked about the additional personnel and not hiring them until the funds were secure? Is that part of the motion or included in that, or?
I don't know that it needs to be a part of the motion. That would be an operational decision. The budget would be there to cover it if the funds are there.
It's probably a separate issue, it should be brought up and voted on separately, and it could either be done tonight or it could be brought up on the next meeting.
Mr. Chair?
Yes.
This is a little vaguer than I'm used to. Given the complexity of the motion and the fact that we're contemplating final action that will not be seen by this board prior to its submission to Clark County tomorrow, it sounds like, I would like our secretary to reread back what the motion is that we're voting on.
Good idea.
The motion before the board is to approve the budget with the asterisk that the item is contested before the court, and include that for both fiscal year 12 and 13.
So may I ask for clarification?
and that
Yeah,
is,
let's be more specific about what the asterisk refers to.
That's the
If I may, if the
$68.99,
maker of the motion might be amenable to a modification. I think what we're suggesting is that the estimated fiscal year 2012 column of the screen before us break the total revenue figure down, which currently is at $68.99 million, into two lines. One line, which is $14.18 million, which is the disputed revenue figure, and the balance being 68.99 minus 14.18, which I am not fast enough to do in my head, nor in fact with this darn computer, because it's new to me too.
5481.
It sounds like it's the wish of the board that the 14.18 be also broken out of the $61 million of revenue that we're forecasting for the fiscal year 2013 budget, also similarly into two lines, one of which is $14.18 million contested revenue, and the other line is the $61 million budgeted revenue minus the $14.18 million contested revenue, and include the other changes that were brought between the tentative budget and the final budget here. Does that sound close?
Sounds close to me. So to clarify, that on the fiscal year 2013, it's the same 14 million, or is it? Okay. And that satisfies you? And we would just list that as?
I just want to point out that I don't think it should be 14.1 for the, or yeah, 14.18 for the fiscal year 13, because if we're assuming, if we're getting 5.6 in FY12 and we assume we're getting 5.6 in FY13, we should deduct the 5.6 from the 17 million, which would make it around 12 million for FY13.
Good point. I think because we've been advised that the real estate revenue will be lesser. Good point.
So what's the number then for the budgeted fiscal year 13 contested revenue?
It's approximately 11,186 something.
You're making me bust out my calculator. So the 61 million you're showing in the final column, the 2013 column, for revenue, isn't that already adjusted that's already got all the reduced revenue that we anticipate happening from all the other sources, is that correct?
The FY13 revenue of 61 million
Right.
includes 17,970,540 property tax allocation from the county, of which 11,186 will be deducted.
So it is reflective of the lesser real estate tax revenue for 13 than what would have been anticipated in 12.
So it will be an equivalent of the fiscal year 12, $14 million.
And how much are you going to be receiving for sure? How much did we receive this year?
This year, 5.6 million.
So that 11 million is equivalent to 2012's 14 million, percentage-wise,
Yes, sir.
Yeah.
right? So the only change is the number. And on the 2013, it would just say all or a portion may be subject to dispute.
So we have the motion. I believe we had a second. We had a clarification of the motion. Any further discussion?
And a modification, which the maker agreed to.
We've done every possible manipulation.
I think maybe the modification of the motion might need a second. Roberts is,
the original motion.
Roberts is different than Mason.
Accepts the modification.
Okay.
Do we want Shelley to once again read the motion?
No. Don't make it.
All right, that said, I think we're ready to vote. Those in favor, please signify by saying aye. Aye. Any opposed? None are opposed. Thank you for your diligence, and
Thank you.
on we go. I know earlier on we talked about whether anybody needed to leave and we needed to move anything forward on the agenda. Anybody have any request to do so? Otherwise, we're going to stick with the agenda.
And I have to leave, so hopefully, that was the most important thing, right?
That is a very important item, not the only important item this evening, but I think we still have a quorum, so. All right, we're moving on. Under Section 5, Number 2 is receive a report of the auditors regarding the Southern Nevada Health District's collection, transfer, use, and disbursement of environmental health fees collected for FY 2010 and FY 2011, and direct staff accordingly.
Okay.
So we'll ask for the auditors to address us.
Right. Let me introduce Mr. Tom Donahue from Piercy, Bowler, Taylor, and Kern, who will present on this item. And he's there at the podium.
There it is. Okay. Good evening, ladies and gentlemen. I know it's kind of late to be talking about boring things like cost accounting and overhead allocations. Anyways, my name's Tom Donahue. I'm with the audit firm of Piercy, Bowler, Taylor, and Kern. We're currently the auditors of the health district. Dr. Sands has asked us to do an analysis on the historical overhead allocation rates that have been used back from fiscal years 2008 through 2011. So that's what I'm here to talk about tonight. So with no further ado, we'll move right ahead into this. So primarily what I'm going to talk about tonight is basically the district's developed its own internal allocation, overhead allocation model, which has been in use since 2008. So we'll talk a little bit about that and how that model works and what goes into that model. The next step, or the next topic, if you will, is what we did is we wanted to run some sensitivity analysis on the assumptions that were used in the model, because there is a lot of judgment that goes into any overhead allocation plan, and so we wanted to run some sensitivity analysis on it to see what the margin of error could be with the models. The ultimate, I guess, objective of this assignment is to basically determine whether the district was in compliance with NRS 439-365, which deals with rates and fees charged by environmental health. And lastly, I'll talk briefly about going forward, some things that could help going forward in regards to overhead allocations and how they're presented in the external financials. So I'll jump right into it, and please stop me if you have any questions or anything doesn't make any sense. I'd be happy to try to explain things to you. So to summarize the health district's internal model, it's not a very complicated model in terms of how it works. As I just said earlier, there is some judgment in terms of what bases to use and how to actually allocate the costs and how detailed you want to be or how simplified you want to make it. The district's model is more of a simplified model. And one thing that's important to note down there at the bottom slide, hopefully everybody's got this slide show up on their screen there. The way the district calculates its rates is it uses information. For instance, the 2008 rates were determined using 2006 financial information. So there's a 2-year lag between the time the rate's determined and it's actually applied. That's not uncommon or unusual in this sort of an analysis. So basically how it works is there's cost pools. The district's cost pools are very similar to that of any other organization. You have administration, which is typically the biggest pool of costs. Within that pool you have things like finance, legal, payroll, purchasing, auditors, all get dumped into that pool. Public information is another cost pool that gets allocated out. Building maintenance, information technology, and human resources. Those are all the centralized cost centers, if you will, that provide services to the service providers or those receiving the benefit of those costs. The way those cost pools are allocated, going right down the same list we just looked over, is administration and public information in the district's internal model use total direct expenditures of the department receiving the benefit. Again, that's a simplified approach to doing it, but it's an acceptable approach to doing it. Building maintenance is based on the square footage occupied of the department. Information technology is allocated based on the number of computers and related devices, meaning printers and things of that nature. And human resources is allocated based on the number of full-time equivalent employees. And in looking at the models from 08 to 11, these methods have been applied consistently. There's been no changes to that approach. So in digging into the model, we found two primary issues with the model. First is the overhead rates that were calculated in the model were calculated using the wrong denominator. The denominator in the model should have been the total indirect cost pool to be allocated, and within the model was actually the total direct expenses of the department receiving the benefit. So that, and the note I put there is that actually resulted in overhead rates that were typically lower for the departments that had the biggest amount of the cost, being nursing and EH. So those rates were actually lowered by that error. And then once you figured out that rate, the model applied the overhead rate to the wrong cost pool. Effectively, it was applied to the direct costs of the department versus the indirect costs of being allocated. So a lot of words there. I've got some slides. Hopefully you'll be able to see them to demonstrate how this thing works and how these issues kind of work their way out in the actual calculations. So I think the next slide. So if there's any questions you have now, they'll probably be answered in the next few slides because I'm having some numbers show up on the screen that actually show how this thing works and how those issues kind of vetted themselves out. The approach we took in determining reasonableness of the rates was to look at it from, to calculate a rate based on the way that we believe it should be calculated, compare that to the rate that was actually used. The staff's actually engaged an independent consultant that specializes in cost allocation plans, and we looked at the rates that were calculated in his plan as well as another way to triangulate what a reasonable rate would be. And with that, I'll kind of show you how this thing works. And please, again, stop me if I'm not making sense here. Okay, so here's the sensitivity analysis. Hopefully you guys can see it. It's kind of microscopic there, but The top line there, going for each of the years that we were reviewing, starting from the left column is the fiscal 11 rates, and it goes across to the fiscal 08 rates. So the top line there is the overhead allocation rates as determined using the health district model, unmodified. So you'll see it in 08 is 20.87, then it goes all the way up to 27% in 2011. Mahoney is the consultant, the next line down, and he came up with an indirect rate. Now keep in mind, that rate is what you would apply to a direct cost in a grant reimbursement situation. So that's not exactly what we're talking about here, but that's the Mahoney rate from his plan. The next line down is the rate that we calculated after analyzing the model. And this is purely for EH, by the way. This isn't for all the departments. We'll get to the other departments later in the presentation. So we calculated, took the internal model apart, put it back together the way we thought it should be done. And lastly, we, using the Mahoney rate, we kind of looked at his plan a little bit differently, and from not a grant application, but from an entity-wide cost allocation method, and those rates come in on the bottom there. Is there, hey Mars, is there any water I can get? Or do you get any water? Mouse getting caught in the mouth here. Excuse me 1 second. Good. One of the important things to notice in this kind of sensitivity analysis here is we wanted to see how low the rate could be, and still have the district to still maintain compliance with the NRS. And that's what the second line from the bottom is on a discrete annual presentation. So in fiscal 08, the rate allocated to EH could have been as low as 19.56. Fiscal 09, it could have been as low as 10.38, and so forth and so on going across. The line below that is to show the effect of a buildup of a surplus or a deficit in those years. So the rate actually gets less as you go across on a cumulative presentation, assuming there's a deficit that builds in each of the years. So that's kind of a sensitivity analysis on the rates.
Do we have a question from a board member?
Thank you, Mr. Chair. On that last slide,
this one?
Lowest overhead rate to be in compliance with NRS 439.360 sub 5. Are you essentially trying to, I mean, that's resting on the word reasonable, which appears to be the only, that section of the law talks about reasonable charges and fees.
Correct. That rate is we effectively back into that rate as to what rate would it take for EH to break even and not have a surplus. So that's the lowest rate that could be charged for EH for the total revenues to be offset dollar for dollar by expenses, indirect and direct.
Okay, thank you.
So here's looking specifically at the details of how it works for. This is kind of the backup, I guess, if you will, for that previous slide, how we came to the numbers there. To Mr. Beer's point there, the break-even column off to the right shows that if you use a rate down there, and this is for fiscal 08, if you use a rate in the bottom right of the slide of 19.56%, you effectively have a break-even. There's some rounding issues going on there, so you get to a net $79 to effectively break even. Going across, the next one, second from the right, is the Mahoney plan rate of 27.74%, shows that EH would have had a deficit of $1.1 million if that rate was used. Going across to the rate that we calculated, $1.2 million would have been the deficit. And going across finally all the way to the left is the actual rate that was calculated in the health district plan, and it shows it's a net deficit of $181,000 for that year. And that's kind of the sensitivity analysis on the different rates that could be used in this sort of a model. And I've got another slide for fiscal 09 showing the same thing. Again, to the column to the right's got the rounding issues. But you'll see I've added a cumulative net revenue expense line there It's kind of middle towards the bottom, showing how the net cumulative expense would build up, depending on how these rates are used. And again, for fiscal 10, same kind of a thing, the break-even analysis to the right. So now you get, even if you go to the leftmost column, let me just fast forward one more slide. So this is through 11. It shows a cumulative net deficit, if you will, in EH of 4.5 million, using the most conservative allocation rate, which is the district's internal model.
That's cumulative over how many years?
That's just cumulative since fiscal 08, since the big rate increase took effect.
Right.
And I believe the next slide, that's again, I apologize for it being so small. It's hard for me to fit it on here. But this shows, this is showing how it would work if the indirect costs were actually allocated in a financial statement setting, if you will. So we've got going across the top there, you've got all the departments, the nursing, environmental health, community health, the lab, health cards, vital records, et cetera. Those are effectively the departments providing services. And then you have the administrative operations and maintenance column, second from the right, which shows, in this case for fiscal 11, has $14 million of costs sitting there. That's effectively your indirect cost pool. So that $14 million is what needs to be allocated out, and this effectively shows how you would get there doing it. And you could actually do this in the financial statements, which is one of the recommendations we are discussing with staff, is to actually make this allocation very visible in the financial statements so everybody can see how it works. And again, this actually shows how much of that cost is being allocated to each division. So for instance, you can see nursing, of the $14 million of indirect costs sitting in that pool, nursing gets $5.5 million of it, EH gets $4.3 million of it, et cetera, going across the columns there.
A question?
Sure.
So the pro forma above is based on which overhead allocation rate?
This particular model, the overhead allocation rate in there is based on the rate that we calculated, which is the second from the bottom there. So for instance, nursing is 39%, EH is 30%, community health 16.8%, and et cetera, going across. And you'll see you get to 100% on the right side, showing 100% of those costs are being allocated. What initially kind of threw us for a loop is if you look at the district rate per the internal model, it flips across to 121%. So that was the first issue that cropped up we were looking at, as something was wrong with the models, because the wrong denominator was being used.
And so the variability here in the net loss of each department is varying not because you're changing any overhead allocation rate, but the numerator is changing. Is that correct?
I don't know if I fully understand your question. It is getting late.
Well, typically, the overhead allocation rate is driven by the internal service fund, right? So we're going to try to allocate all the internal service fund across the users.
Right.
So the allocation rate, once we determine what the allocation mechanism is going to be, FTE equivalents
Right.
or square feet,
whatever it may be, yeah.
is the same per FTE, it's the same per square foot, whatever the mechanism is. The percentage variation you're showing here, because it adds up to 100, is really differences in the thing by which we allocate. So nursing has more FTEs or square feet.
That's
than
correct. You're
environmental
correct. Now I
health.
understand your question. That's correct.
Or they may have used more administrative services.
Well, the way the district model works is a large portion of the cost, meaning the administrative costs, are actually allocated based on total expenditures or expenses of the department.
So, I'm sorry, did you say that your mechanism for allocation is the percentage of the total budget that belongs to that department?
Depending on which cost pool you're talking about, for the administrative cost, that's correct. For human resource-related costs, it's full-time equivalents. For maintenance, building maintenance, it's square footage. But the lion's share of the cost pool is the administrative cost, the finance, the legal. And in the district model, the reason it kind of skews a lot of the indirect costs towards nursing and EH is because they have higher expenses in the fund financial statements, which these numbers are based on. So I think you might, I don't want to try to read your mind, but where you might be going is in the plan that the consultant has come up with. It's a lot more of a refined approach in terms of how you carve up that administrative stuff. There's different bases for how you allocate legal and how you allocate finance and things. It's not just based on total expenditures.
That's required to keep the consultants busy.
Any
All
other
right.
questions on that? I've got a couple more slides. Any other questions on that before we go into the I guess, the ultimate
I think,
objective?
I mean, the general gist of what I see there is that if we're looking at EH, they had, in terms of overhead costs, were less than the actual cost of overhead costs. The allocation to them was less than what they received in benefits by about $1.4 million.
What was allocated to them was actually less than when we recalculated the model, what it should have been, and based
Okay.
upon those allocation bases.
All right.
So moving right along here. So this is the NRS, and it basically states that subject to the prior review and approval of the Board of County Commissioners and except as otherwise provided in NRS 576.128, adopt a schedule of reasonable fees to be collected for issuing or renewing any health permit or license required to be obtained from the board pursuant to a law of this state or an ordinance adopted by any political subdivision of the state. Such fees must be for the sole purpose of defraying the costs and expenses of the procedures for issuing licenses and permits and investigations related thereto, and not for the purposes of general revenue. So the purpose of the analysis was to show that the fees charged by EH when compared to the total costs of operating EH, direct and indirect, is there a net surplus or a deficit when you look at it that way? And what the analysis is showing is there's a net deficit in each of those years. So therefore, that's the primary basis to conclude if there's in compliance with this NRS or not. So basically, what I guess I got ahead of myself. Based on the analysis that we just looked at, using 3 different approaches to get to the right overhead allocation rate, it appears that the EH division is operating a deficit, as we outlined in all those slides, foregoing slides. In other words, the fees currently being charged by EH do not appear to be sufficient to cover all costs when you consider the indirect cost allocation. So that our tentative conclusion is that there does not appear to have been a violation of the NRS. Tentative because we'd like to look at the Mahoney cost plan. So basically, we had a meeting back in early April with the consultant and all the division heads to look at the more refined, if you will, allocation plan that the consultant put together. And some very good feedback was obtained from the division heads and given to the consultant to go back and refine his plan. One of the big things that was noted in that meeting was the consultant had mistakenly included some direct costs in an indirect cost pool. So what that's going to do is it's going to lower, in his model, the overhead that's being charged to the other divisions because those costs should have been direct costs instead of indirect. That being said, I don't see it, based on the analysis we've done, I don't see that resulting in any kind of violation or non-compliance with the NRS, but I'd like to see that plan before we make any kind of final conclusion on that.
Questions? We'll start with Mr. Beers.
I apologize, we don't have a copy of this, so I can't reference page numbers.
Oh, I'm sorry.
And go back and forth with you, but it
Do
was...
you have it on your screen?
I do,
Okay.
yeah, I can see what you have up here, but I don't
Okay.
have it where I can page through it, I just get what is shown up here. So if we could go back one page, one more, right there.
This one?
So, if I'm understanding this correctly, we're over allocating overhead to environmental health, but we're not charging all of that to our customers because environmental health is running at a deficit.
That's correct. If the way the analysis works out, it shows that the fees currently being charged by EH aren't sufficient to cover all the costs of operating environmental health if you include the indirect costs.
The overhead that was allocated. But you came up with an allocation rate that was less, that was smaller.
It was actually higher. It was actually higher, I'll show you.
75%.
Bear with me while I go back to the early slide here. So the rate, do you have this on your screen?
Mm-hmm.
So the rate that was actually used in the health district analysis is on the top row there. So 27, 24, 23, and 20 going across the top. The rates that we calculated using the same model, just applying it, calculating the rate differently and applying the rate to the indirect cost pool as opposed to the direct cost pool, is the third line down from the top, of 30, 28, 27, and 28.
However, the lowest overhead rate to be in compliance with 439 is 17, 20.
Correct. That's not what we calculated the rate should be. That's what we calculated in a sensitivity analysis, the lowest it could be, and they'd still be in compliance with the NRS. So that much less.
But any rate higher than that is out of compliance. Any rate lower than that is clearly within compliance?
Any rate lower than that is out of compliance.
Out of compliance.
That's correct.
Well, can I ask a quick question then? But what is the point of going with a higher rate if it just throws that department or any department such as nursing, EH, into a negative balance, into a deficit?
I think the objective of the plan is to try to find the most logical and rational way to figure out of that indirect cost pool of in 11 it was 14-something million to allocate that to the departments that are receiving the benefits. Not necessarily to get one department to break even or anything like that. It's to basically say nursing gets the benefit of administration, so that their share of the administrative costs should be this based on some rational model of
Well, I understand, but how do they ever pay that if the payment of that puts them into a deficit? Because when you showed us the next slide after this, it was putting all the
Right.
departments in a
All
deficit.
the departments go, and again, it's not to necessarily be repaid, it's just to basically show how those costs are being allocated to it's not, they don't necessarily have to repay it back, for instance, it's just to kind of demonstrate that of these costs, of the $14 million of costs, $5 million actually benefited nursing, $4 million benefited this, et cetera, et cetera.
The rationale is that environmental health charges fees for permits, and those fees will cover everything from paying their staff to their overhead costs as well, versus nursing doesn't charge fees for everything that they do, but there's still an allocation cost of what their overhead would be. Go ahead.
So, should we raise environmental health fee revenue by increasing fees so that environmental health breaks even on paper with the overhead allocation? We would then be in trouble with NRS 439. Because what you're saying is that we're over allocating overhead here, but because we're running the operation at a net expense, we're not recovering the full amount from our users, thus we're fine on NRS 439.
I think that's correct, if I understand what you said. As long as the NRS is basically precludes you from charging rates for EH and then using those excess dollars for something other than EH purposes.
Right,
So
which
as
is
long
what
as-
we'd be doing if EH ended up with zero by increasing its revenue.
Right, if for by
But-
some reason the rates got higher or somehow the costs allocated in were lower, you could run into that situation.
So we're currently over allocating costs, but because we're not collecting it from EH users, we're okay with 439.360.
I believe that's the case, yes.
I don't know if this is saying the same thing. My understanding is EH is not collecting fees at a high enough rate to cover their full expense in terms of their overhead expense.
And I think what this presentation is saying is that that's because the full expense of EH is too much. Because we're over allocating overhead to it. But because we're not charging that to our customers, we're not in violation of
I guess what I'm hearing,
439.
we'll leave it for more, what I'm hearing is that there is less being charged to overhead than the actual services received for overhead in EH.
The primary point to illustrate is that the fees, based on the internal model that's being used to allocate costs, the fees that are being charged by EH currently are not in excess of the total cost to operate EH, meaning direct and indirect. I mean, that's the point that I'm trying to make with the slide.
However, I think you're also saying that's true. That's true. Well, I think what you've done here is you quantified that we are 10.04% too high, or we're 10.04 points too high on our overhead allocate. We're allocating overhead at 27% rather than 17%. But it's okay, because that 10% over allocation, we're not collecting from our customers. Instead, we're letting that build up as a negative deficit for that fund.
Right. Let me make sure I clarify something. In fiscal 11 there, the 16.99% isn't, I'm not saying that's what you should be charging is overhead. I'm saying that's the lowest rate that could be charged.
But the law says that's the rate we should be charging if we're collecting everything. If we're going to be assessing on our users the full amount of our expense, to the extent we allocate overhead higher than 17% and collect it from our users, we'd be in violation of the law.
That's correct.
Yeah.
Question, if I might, Mr. Chair?
Go ahead,
Thank
Commissioner.
you. If we didn't charge the indirect costs, where would EH be?
We can look at that, I think. Let's see. So for instance, we'll look at, so right now you should have on your screen 08. So the lines going all across the top for 08 are the same, so 16.5 million in revenues, direct costs of 13.8 million. So somebody that's better at math than me could tell you, and then it shows you the allocation. So basically you'd be 2.9 million. If you took that out of there, you'd have about 2.7 million of net revenue. So if you took out all the indirect allocated costs for that year, you'd have about 2.7 million net revenue.
And if that's the case, because the whole, EH is the only one that actually pays for the indirect costs. The other departments don't pay. They're part of the formula, I'm assuming.
My understanding is back in 2008, I believe it was, as the rates that EH charged were increased to cover their share of the overhead. So that, I think what you said is true. That would be tantamount to them paying for their overhead through their rates they charge.
Right. And so even then, they were netting 2.5 million. If you didn't take out the indirect costs. If we just raised the fees and that was it, didn't charge for the indirect costs, then they would have been to the good.
Yep, roughly about 2.7 million.
Okay. And part of my argument has been that the property tax dollars that the county provides was to help offset those indirect costs so that business did not have to become the one that picked up the new policy that we put in, that, well, was never actually adopted that I recall, but the indirect cost policy. And therefore, they could have made money, which would not have been right for the rate increase that we did that year, which was, I think, 18% or something along those lines. And then created an indirect funding formula, but only one department actually pays for that formula, and all the other departments, which actually used more based on your design, more administrative especially in some cases, they used the general fund or the property tax dollars to offset those. So I don't think anybody ever misused money in any way. It was the debate of how did you make the determination, because go back to the language, the NRS, if you would, the 360.
Sure.
In that language, it says, and not for the purposes of general revenue. And general revenue, in my mind, I could be way wrong, there are certain charges that business has to pay no matter what. Your administrative, your IT, your HR. To me, that was the general revenue, and the reason they got a portion of property tax was to offset that cost so that they didn't then raise fees or rates to the private sector to have to offset 100% of their costs. And I still think that that was really what the intent was. And so when only one department pays it, and when they would have actually, after we put that rate increase in, been adding to the general fund $2.5 million, then we overcharged in fees to the private sector to subsidize something that they already get 3.5 cents worth of property tax for. So I'm still, in my mind, just trying to clear that up. That was part of our discussion last week. I don't think it's a philosophical. I think it's a practical one that at some point we have to resolve. There's a cost to doing business. Otherwise, what is the reason the county provides any funding? Then you guys should be doing everything on grant and fees, then, if that's the case. And to me, that was to cover the general revenue component of it and not have private sector have to pay for that part, because there's a cost to do business, and that's what the property tax, in my mind, was supposed to cover. So that, just to kind of recap where my brain was at and has been. So I appreciate the analysis. So the Mahoney thing used direct costs versus indirect?
The primary purpose of the Mahoney report was to basically make sure the indirect rate you charge on grants is, you can kind of shortcut doing the long drawn out, I don't want to bore you guys with the grant stuff, but you can come up with an indirect rate, charge that to the direct costs that you're submitting on a grant, and typically get that approved by the feds. That was the main purpose of the Mahoney report, and I think therein kind of came some of the confusion, because the internal model took a similar kind of an approach, but that's not the approach you take when you're trying to allocate overhead across the whole entity.
Right.
So that's, I think.
So did that put us at any risk with the federal government with regard to how that allocation was done in the other departments that receive grants?
I don't believe so, no.
Okay.
Another question from Mr. Beers, please.
Thanks. What is the extent of federal funding? We had an incident, Chris and I were involved, Commissioner June Kiliani and I were involved with in Carson City, where we had not spent the full amount of an internal service fund that was budgeted. But we allocated the full amount of the internal service fund budget to other departments, some of whom were reimbursed by federal dollars, who after a period of time came knocking on our door and wanted a refund for the overcharging. And thus, I think her question is important. If the overhead allocation rate that we're running is too high, is higher than the zero line, and we got reimbursed from the feds on some of that, that's something we need to keep track of.
And that's something that was actually brought to light in the meeting we had with all the department heads back in it was earlier this month. I don't recall exactly what day, but that was the input from, I believe it was Dr. Madaw, kind of enlightened Mr. Mahoney on, some of these costs that are in here are actually direct costs that are funded, directly by grants, and they shouldn't be being allocated and effectively getting that double whammy effect. So that is definitely on the frontal lobe to make sure that's not being done.
And also just to add to that, and, you know, I'll ask Mars if he has, you know, correct me if I'm wrong, the Mahoney, you know, allocation that's been developed for the district, or is in the process of being developed for the district, similarly like he's developed for other entities, actually came out of, since now that we have started receiving a large amount of federal grants through the CPPW, and you know, our efforts have been stepped up to receive even, you know, more direct federal grants, that in order that we needed to have a cost allocation plan prepared that met the federal guidelines, so that when we did apply, if we did apply it to a grant, that, you know, we can demonstrate how it was done according with federal guidelines. Since we're not, and because of the entity that we are, they haven't recognized us for an indirect rate. They will recognize like the state and the county and the cities, but they won't officially recognize us. But they say what we can do, but we still can charge indirect, but as long as it follows, as my understanding, as long as we follow the guidelines, and we need to have that backup. In past, because main federal grants that we received came through the state, that the state for a period of time did not allow the local jurisdictions to, or the subgrantees to charge an indirect rate, and over time, at least through the local health authorities, were able to get agreement with the state health division to be able to charge indirect, and to use their indirect rate as part of, you know, the indirect. But before that, since they wouldn't allow indirect, that you know, many items that would normally be an indirect were actually then put in as direct costs. So, you know, having like an IT person or even an accountant and actually directly budgeting that. So, and we do have that from time to time with different grants. So that's why it's important for staff to sit down with Mr. Mahoney to clearly, you know, let them know, you know, when things have been directly charged on a grant versus something that isn't. So I hope that information helps.
All right, any other comments, questions? I don't know if there's any particular action to be taken on this item. It's informational. I think the question was whether or not fees from environmental health were being used to subsidize other operations at the health district, and it would appear that that is not the case.
Yeah, just to wrap up, this is going forward. We already talked about Mr. Mahoney. He's back in the shop working on his plan, and when that comes out, we'll obviously take a look at it and get together with staff and the division heads and look at it and see what effect, if any, that has on our tentative conclusion. We're in the process of finalizing a formal report on what we've done and what we found and the specific procedures we performed. That'll be in writing, and we'll issue that. And also going forward, we'll work with staff and to maybe implement some of these allocation models into the actual external financial reporting, so it becomes a lot clearer and easier to see how these costs are being allocated across to the various divisions. And that's all I've got.
I don't want to belabor the point,
It's only 8:30.
Mr. Chairman, but I do have one question. Do we still have the old Bill Bible group that reviewed rates and tried to basically opine on issues like this? Because clearly it looks to me like the industry and all industries that are paying rates are paying a higher percentage than they need to, because the allocation is not as large as it should have been to cover some of those administrative costs. Am I correct?
Well, I mean, as far as, I'll let Mr. Donahue comment on the last part, but the first part, that through the Nevada Resort Association, from time to time, we do meet with that, you know, with that group when we have issues like this. And actually, I think we've been, you know, trying to meet at least a couple times a year to talk about different, you know, issues of mutual concern. But basically, that's through the Nevada Resort Association that we've been meeting.
As I recall, when this was last brought up in 2008, of that group that met under the umbrella of NRA, did buy into the concept that the fees would encompass 100% of the expense, overhead costs as well as operating costs. And so that was the fee structure that was created. If we're going to back away from that a bit, such that the overhead costs are not included in the fees for permits, then that's another direction to take with going forward. But at that point, it was going to encompass 100% of the expense of providing fees.
Thank you, Mr. Chair. I think that if the Environmental Health Fund ended up with a zero balance at the end of the year, you'd be right. That industry is paying too much. What we've got here is a case of over-allocation of administrative expense, but we don't charge for it all. So you end up with EH having a deficit, but that deficit is because we're overcharging the fund with too much administrative, but we're not collecting it, I think is the case. If we, like I said, if EH ended up at a zero balance and we set revenue fees to equal the expenses that we're reporting, you'd be right. But because we don't, because revenue is short of all those expenses, that surplus at the bottom represents overhead allocated that wasn't collected. And hopefully, that's the right amount that brings us in compliance. It seems from this report that it is. The danger is that we look at the deficit that we report in EH and say, oh, well, we better raise our fees in order to erase that deficit. The deficit is caused by overallocation. Does that sound right?
I guess that's the way to look at it is I believe the same model was used when the fees were I think it was 2008, correct me if I'm wrong, when the fees, I think when the concept of including the overhead component of costs into the fee structure came into being, and this model was used, I believe, as the basis to set those rates. So I think the intent was to get the rates as close as they could be to actually to cover the total cost. I think when we went into the model and dug into it, we discovered some of those fallacies in the model in terms of how things were being allocated, and led to those kind of swings in the rates where it gives the impression that it doesn't really give the impression. It shows that if you allocate what we calculate to be the cost, you end up with a large deficit in EH, over a deficit over the revenues, net expense, if you will. I don't know if that answers your question, Mr. Peters.
One more whack at the almost dead horse. I think I understand what you're saying. However, the rates you calculated were using our model.
That's correct.
Which may well be flawed. That's one of the questions we don't know.
Mm-hmm.
Meanwhile, you calculated the break-even point over there in the internal service funds, and that resulted in a 19% overhead allocation rate? That was the minimum amount that you had down there below there?
Yeah, I'll get back to that slide.
There you go, right there.
Depending upon which year you're looking at, it's as low as 10% in 9 and as high as 20% in 10.
And if that were the amount that were allocated, then the internal service funds would come to zero.
Effectively, the internal service fund isn't used in this, in the concept you're...
Well, kind of it is. I mean if this is a debit to the department's expense and a credit to the allocated overhead inside the internal service fund, it is.
Effectively, yeah. That column that has all the cost pools in it, that would zero that column out and be break even in EH.
So the internal service fund would be zero at 16.99% allocation rate. We have actually over-allocated because we're using a higher rate than that. So the internal service fund, if we posted the journal entries, would be negative.
No,
I'm sorry, it would have a credit balance.
Well, I'll show you how it works here. Make sure I'm following your logic.
Yeah.
This is kind of how it works here. I think when you say internal service fund, you're talking about the second column from the right.
Yes, administration, operations, and maintenance. Yeah.
So using the rates third from the bottom there, I guess you will. This is using those rates, the rates that we calculated. Zeros the internal service fund out, if you will. What's that?
The 39% in the nursing?
39 nursing.
But that's not a rate, that's an allocation of expense.
Exactly.
That reflects blended rates and blended metrics used to apply that rate.
That's correct.
It doesn't represent a different rate for each department. It represents a different total amount of the administration, operations, and maintenance allocated to each of the first 5 columns. But the percentage you've got there isn't the allocation rate. That is the percentage of the total admin, operations, and maintenance allocated to that department. In other words, one of those rates, I think we're talking about the indirect rate per 2010 Mahoney cost allocation plan. Is that the one that was actually used?
No, the top one was the one, the top one is the one that the internal model came up with.
And what is reflected in, you've got 4 to 5 rates reflected in each column.
Right, and the rate
down at the
that's-
bottom. Which rate is being used to calculate the allocated overhead as adjusted by PPTK?
The rate that says PBTK indirect rate, it's the third from the bottom. there.
Okay. But so that 39.01% is actually 5.537 million divided by 14,194,543.
That's correct.
So the rate of allocation isn't different. The scheme upon which we allocate is different. So there are more people in nursing, or more dollars in the budget for nursing, or more square feet being used in nursing.
That's correct.
So what's varying there is not the rate, but the thing that we're allocating to.
I think I'm finally following what you're saying now.
Right.
It's their use of overhead services is different.
It's their
Their
use of
total use
over, you can put it that way. Yeah, their use of overhead is different.
Right.
And it's dependent upon square footage or full-time employees or number of computers or what have you.
So that doesn't tell us, really, this slide doesn't tell us what the allocation that you've calculated is. Is it $3 per FTE and $2 per square foot plus 25 cents per budgeted $1 million? Can't tell from this slide. We can tell the result of that complicated allocation
Right.
scheme is
There's
that
a lot of detail
39%
behind it.
of the total admin, ops, and maintenance is allocated to nursing.
That's correct. I don't have the slide, I didn't put a slide in here that shows how the 39% was calculated, but I do have that in my materials.
So going backwards then, a couple of slides, right?
This one?
Sure. The break-even column uses the 16.99% rate because it more or less adds in just enough overhead to achieve rounded to zero
That's correct.
net.
Yep, that's correct.
To the extent we use a higher rate than that, 16.99%, then we end up with a cumulative or a net expense, a net deficit
That's correct.
in each of the first 3 columns, which represents an over-allocation of overhead if we are to recover the full expense from those we charge.
That's correct. If
But
those-
we didn't do that.
That's
right?
correct. That's how it works out.
So to be accurate, we would probably want to drop the overhead allocation rate to 16.99%, which would result in,
But aren't you also saying at this point, based on the information you
Yeah,
have before you, that
yeah,
Piercy Ballard thinks we could allocate even more overhead to EH than we have, and thereby justify the fees we're charging, because the health district says we're charging 27% indirect cost overhead. Piercy Ballard says we could go as high as 30% indirect cost overhead, and that's reasonable, correct?
That's right. I mean, again, the objective of this wasn't to try to figure out what the right rate should be. It's to basically take the model, take it apart, put it back together, and see, basically test the model that was being used. The model that came up with a 27% rate. Again, the objective of this is to figure out how much cost to allocate based on the benefits being received in the department. Not necessarily to a means to justify an end, if you will. It's basically say EH or nursing or community health. If you run it through the ringer, send it through the gymnastics of the cost allocation plan, in this case would get, EH would get in this case $3.8 million of the total cost to allocate. It's not necessarily to say it could be lower, could be higher. It's to try to take your best guess at what it really is, if that makes any sense. It's
Right,
not.
so-
It's not to come up with a predetermined rate.
Right, you're trying to come up with the reasonable indirect cost allocation, and that could be anywhere between 16.99 and 30.12.
Yeah, basically the first three columns, the actual PBTK and Mahoney, are kind of the best attempts at trying to allocate the cost. The break-even column, I just threw that in there to give you some idea how.
Even Mahoney says we could go a little bit higher than what we're currently charging in indirect costs, and that would be reasonable.
Correct. Correct.
Missing from this analysis is how using that 27% overhead allocation rate makes the general and administrative fund look at the end of the year. If you actually go through the exercise of posting debits to these departmental expense accounts and a credit to allocated expense in the, what I'm calling an internal service fund because it's shorter. If that gets to zero, we've allocated the right amount.
Right, and you'll notice.
But I thought you said in an early slide that the sum of their allocation was 120%.
This one right here. That was the first indicator that something was wrong with the internal model.
Indeed.
Because when we ran it across, the allocated overhead was it didn't net to zero. It didn't zero itself out.
120% of the actual G&A expense.
Correct.
So we'd over-allocated at these rates. We had burdened the departments with too much expense, evidenced by a credit balance coming into existence at the end of the year in the administration, operations, and maintenance.
Had the allocation, that's the other piece of the thing, is had the allocation. This is all done internally, but it's not done in the CAFR like this, if you will. It's done internally for internal purposes, but it never makes it to the external financials, which is, had it ever done that, it would have popped out just like it did in this analysis.
Right. Okay. So I think what you're telling us is that your fiscal year 11 analysis shows that there was around 20% too much expense allocated to each department in total, based on 20% of the spending in admin and operations being left over in the credit column at the end of the year.
But if you get too close to 16.99%, you run the risk of running afoul of the law, and you don't want to do that. So, I mean...
Well, going the other way. The reason that we are in trouble, but we're not in trouble because we didn't actually charge our customers this. We ended up with a deficit instead at the end of the year because we've allocated too much overhead. That's how I read this. We've got 120%, 121% of the overhead's been allocated, and the target's 100.
Yeah, obviously the calculations don't work out when you add up to 120%. That's based on the health district's own internal overhead allocation rate. And Mahoney has a different rate, and Piercy Ballard has a different rate, and any of those rates, it sounds like, are reasonable as long as you don't go below the 16.9%.
I got to say, I learned how to talk like this from Mr. Bowler.
I'm sure.
Who sends his regards, by the way, he's out of town.
Got to pronounce his name correctly here. So what do we do with this information, Mr. Chair?
At the end of the day, the only department that charges, in a sense, for these expenses is environmental health. If you take a look at this chart we're looking at right now, environmental health was charging at 27%, and the BTK model would have allowed for charging at 30%. In a sense, environmental health was undercharging their overhead. All of these other departments, while they may be skewed, let me finish, while they may be skewed, they are not charging the public for their services.
Is the top line what actually happened? Is the SNHD rate what actually happened to determine the charges in EH, the fees in EH? I don't know the answer to that question.
Is that a question for me, Bob?
Well, I'm not sure. Is the top line what was actually charged internally?
Yes, the top line is the...
But that's not what these financial statements reflect.
No. The financial statements reflect our best guess at what it would look like had the rates been calculated correctly and applied to the correct cost pools.
Which again, until we look at the detail of the overhead allocation mechanisms, we can't really.
I think the primary thing you said at the start is we just want to make sure we're compliant with the law. If we're using it for another purpose, we're trying to beat up EH because we think somehow they're not
this is
covering their costs. That's not what this is all about. This is
agree.
all about just making sure we don't run afoul of the law. So I think we just take the information. The study's ongoing. They're going to come back to us again.
And I would agree, to be clear, this has nothing to do with EH's operations except in setting their rates. This is all accounting magic.
Right.
And I use magic in its most positive, euphemistic, glorious sense of the word.
Okay, then.
So in the end, you're going to get back to us and let us know whether, based on Mahoney's rates and the other input you're going to get, whether we need to make an adjustment or not.
Correct. If there's any, I don't expect there to be any shocking revelations when Mahoney comes back, but I'd like to take a look at that report before we conclude on anything.
Okay, then. Thank you for your time. And,
Thanks.
we'll close this item. Moving on,
Talking
item
about
number 3.
accounting. How do I turn this off?
Receive,
There's the middle button, and the red light will go off. Just keep pushing, there you go.
anyway, we're moving on to item number 3, receive and consider information from staff regarding the practices and procedures related to outside employment and propose modifications to the same.
Okay. This is Angus McEachern, and I think this will be very short because of the events of the past week, we have some of the meetings that needed to take place before bringing this forward were not able to take place, and I'll let Angus explain that to you.
Good evening. I guess I'm on.
There you are. We turned you on behind you.
Am I on?
Some
You're
magic
good.
guy out there turned it on. Now you're off. There's a red light. There's a
Now
little
you're
red light at the top of your microphone. There you
Now it's red, okay. This is all going to take longer than this discussion's going to take. On the magic day that we're going to meet with our managers to discuss the proposed new rules regarding outside employment, we closed the building. So we couldn't have a meeting. So because of that, we haven't been able to meet with the union either on this item. So what we're asking is that we put this off until the May meeting so that we can complete our meetings with the staff and bring back to you the final report on how we feel the internal regulations would be held as far as outside employment is concerned. Again, we're not proposing still at this point any change to the personnel code, but we want to let you know how we're going to regulate this process better so that everybody knows what's going on an annual basis.
Comments or questions? Commissioner?
Thank you. I think that makes sense. And maybe also, I think you're looking at other forms from other jurisdictions to see if at least the information that's initially asked for is more complete, I think, as well.
We have that already done, ma'am.
Okay,
yes.
all right.
All right, then we'll go ahead and close that item.
Thank you.
Thank you. Item number 4 is receive an update from PGAL and Walter P. Moore regarding the detailed structural engineering report regarding potential Ravenholt building repairs and associated estimate and projected costs.
Good evening. I'll let him get my presentation up. But while we're doing that, our assignment was to answer one of the questions about what does a fix look like and an order of magnitude about what that would cost and how would that compare to some other options. And so we've got a short presentation to do that. Just as a point of reference, this is the existing building. And the three comparative analysis that we looked at, one was to do a repair based on the discussion that we had last week, prepare order magnitude, comparative costs. In order to do that, we simplified the comparison by assuming that the size would be the same, not increasing in any of the other options. So as I said, option one was to repair the existing building. And in that repair, we assumed we were not putting back on the over roof. We were just repairing pieces that we needed to.
So the repair involves temporary bracing of the walls, followed by removal of the overframed roof and removal of the roof deck. Then replacement of foundations that may have been damaged by sulfate attack, and then repair and replacement of sections of the exterior wall that are damaged. And this is also going to extend to replacement of walls that are going to be part of new shear walls, as we've found that the existing reinforcement in the walls is not adequate per the original 1961 building code or the current building code to act as shear walls. Then repair of joist seats and anchorages, and then installation of a new metal roof deck that is attached to the joists and the perimeter walls, and that is specifically designed to carry the diaphragm forces under the current code. And then finally, bracing of the interior walls.
So in addition to those structural repairs, we also assumed that we were replacing, putting in a fire sprinkler system, replacing the plumbing systems, doing ADA repairs as necessary, replacing utilities to the street, replacing any finishes that were displaced, and replacement of mechanical systems that we displaced by taking the roof off. So in the budget assumptions, again, we assumed in this first option that about 40 to 45% of the existing building would have to physically come down and be rebuilt. And we were only repairing any critical systems to that building. Assumed some abatement was required, that we were going to have to build out of sequence in order to accomplish that, which created some premiums on the construction, as Dennis said, bracing the walls, and that the building would be vacant through that whole period. And the number at the bottom is only construction costs. It doesn't include any soft costs or FF&E contingencies, move costs, things of that nature, and doesn't include any temporary housing costs. So $18.2 million is a budget construction assumption to repair the main building. A second option, just to illustrate how that compares to an alternative, is to demolish the existing building and physically rebuild it in its exact configuration as a comparison of new construction as opposed to the premium for that. And under that, the assumptions were we were doing a complete demolition, and we were putting the same program back that was there currently, and we were not putting the over roof back on, and that we were building it back to meet the new building code, which includes a lateral system, fire sprinkler system, things of that nature. Same assumptions. The building is still the same size, and that number is about $18.5 million. So essentially, the cost of our repairs, based on what we know, and the cost of demolishing and building back the exact same thing to current code, we think is a wash. As a third, just comparative analysis, is what would be the cost of just building a rectangular building of the same square footage and that same footprint, just so you have a sense about what that would be. under that scenario, it's 60,000 square feet, so the square footage is the same. We assumed that we were putting in the same program, and under that assumption, the estimated construction cost is about $16 million. So we think to replace in a rectangular program is about $2 million less than those other two options. So in summary, these were the three scenarios that we looked at to help give you some information about what a repair cost might look like compared to reconstructing it. So with that, we'd be happy to answer questions.
I know when we had looked before at a building replacement that was, I guess, more sophisticated than just putting in a square building. What was our cost estimate? Which
Well,
I
it was
realize is out of date now, but.
Yeah, it was a much larger building. This is for 60,000 square feet, and the building that was on this site was about $65 million in rough total project cost, not just construction costs.
Right.
And so you have to add other costs onto these numbers to get to that.
So if you really did option 3, what more expense would come about?
Well, this is only represents 60,000. In the original new building option, it was bringing all of the other departments from the leased spaces back to the main campus or to wherever the main building was, but also to build in some future growth. And that represented a program of about 160,000 square feet, as opposed to this building, which just has 60. There's another 12,000 in the HR building that's not included in that.
And the price for that was?
Total project cost, when we looked at it before, was about, if I remember, it was about $65 million. But that included everything, where these numbers are only construction costs.
Question for Commissioner Scow.
Okay, and what would be the comparison in those two of a square foot, cost per square foot? Or do you have that in?
The comparison of these three options?
No, of the rectangular building versus the new configuration, larger.
We used the same unit cost per square foot
Same.
on option 3 that we had projected previously on the larger building.
Mr. Chair?
Yes.
And I guess this is more for Dr. Sands and Annette, but as I understand it, this building remains the property of the county, correct?
That's my, yes.
Now, technically, are we leasing it? Or, because I don't know what the terms are, that kind of happened before I came on board, and probably before most of us came on board. So, I mean, what is our responsibility here? Are we supposed to return the property to them in the same condition we got it, or do we just tell them the lease is done because the building is on the verge of being condemned, or what are our legal responsibilities here as the board?
Well, I'll share what I know or I understand about it is that it is a county building. Our status is that, that the health district occupies it. It was from, I think, the historical information I think we gave you last time, it was built through a bond that was put out back in the early 60s. So there hasn't been any lease payments or, and so the district's been occupying it for, almost 50 years now. And as far as what to do with it, yes, I think that would be, I think that's probably the next call, is that if we don't make any changes or repair it, then basically we'd have to return it back to the to the county. I don't know if there's anything that's written or that prescribes what we're required to do. I'll leave that for council.
I don't have significantly more information than that. I'm not aware of any formal lease agreement. It's my recollection that when the health district initially moved into this building, there was some amount of money that was given to the county to offset social services department going into another building or something along those lines. And I want to say it was anywhere between maybe $300,000 or $400,000 that changed hands at the time that the district initially moved into the building. But beyond that, I'm not aware of any formalized agreement.
Okay, so the basic deal was we would move into the building, we would be responsible for its maintenance and upkeep, but there was no lease charge or anything like that. We haven't been paying any kind of rent or lease payment.
That's correct.
Okay, so then depending on what Las Vegas Building and Safety does, as far as whether this building is condemned or not, then that will decide what we need to do as far as our contact with the county, as far as any movement forward.
Yes.
Okay, thank you.
Question? Thank you. Is it Pigalle and Moore?
Maltby Moore,
Right.
correct.
If you look at this property, because the property is also the county's, did you ever look at if you constructed a new building on that property just in a different location? Could you then do a larger footprint? So then you could just tear down the older building. And it's something I've always argued with the school district to do when they had parks and schools, is flip it, and then you can get a brand-new property and not have any downtime to some extent. Except now is a little different.
Yes, the original project that we designed several years ago did exactly that. It built the building and the back part of the site.
That's
so
what I
the front-
thought.
So the front
Okay.
building could remain in operation, and there was lots of phasing costs to allow that to happen. But that was exactly what we did.
Okay. And so at some point, as a board, we'll take a look at that, because I know there's a facilities committee, but I was first on the board after you brought your drawings in, back in '07, I think it seemed to me. Second thing is, as in reading the report that was done, there's been problems with this building no matter what. The irony is that it was built without the diaphragm in the first place, somehow signed off, because it was never to code. And now it's structurally unsound. And I think maybe it'll be the next agenda item that will really get into the meat and potatoes of it, but as a building, the issue was the wind shears more than anything else, because there's no bracing and no ties, so to speak, on the walls to hold anything up, which gives it the ability to move back and forth. Is that kind of what it comes down to?
The primary issue is the lack of a functioning diaphragm. It's actually an issue whether it be for wind loads or for seismic loads. It's just easier to explain in terms of dealing with wind loads, and so that's why we use that as a basis for our conclusions.
Okay. And in the report, I didn't see this. Did you give the district a timeline to close the facility and move people out?
No, we didn't. What we said, based on the building code, gives us parameters, defines for us what's considered a safe building and what's not. And when we went through this analysis and determined that it wasn't just marginally less than what the building code determined to be minimally safe, it was a lot less than that, we recommended to the district that the building not be occupied at that point.
Okay. And as Moore, you're Moore?
Walter P. Moore, yes.
Okay. And Pigalle hired Moore to do the engineering. You're very well respected in the industry. I will say thank you very much for that. I do believe, though, that our discussion several months ago was that we wanted an arm's length away from whoever did any kind of an engineering analysis, and then our architect hired the company that did the analysis. But be that as it may, at least you're very well respected within the industry. That's just more of a conversation piece.
Thank you.
Thank you.
Any other comments, questions? All right, thank you for the update. And we go on to item number 5, which is receive an update regarding ongoing facility and operational needs.
Okay. Good evening. I think we have a slide set here. And what I was, do you have the slides?
they're getting it. Anyhow, what I believe I was asked to bring is a plan of a relocation plan, and what I want to do is kind of give you an update on where we're at with relocating displaced staff and programs, as well as what our space needs are, our current ongoing needs are, and as well as to share what our goals are, objectives are, and options for moving forward to address the ongoing space needs. You do have in front of you, just so you know, a copy of the service locations in terms of where services are being provided now, and I'll go through more about where everybody's at. First of all, I just want to share what our overarching goals are in this whole process. It's first to establish district operations, and that's what we've been working towards over the last week. The other is, and that's so we can maintain a high level of service to the community while also sustaining staff levels that are necessary to achieve the district's mission. So we want to keep our workforce engaged and in the business of the district. Just so you know, just to see what was at the Ravenholt Public Health Center located at 625 Shadow Lane. There was over 60,000 square feet. There were about 199 employees housed there, and it contained staff from administration, environmental health, clinical nursing. Primarily, there was one staff member from community health that was located also in there, and they were easily to be relocated, as you'll see in a moment. The others is that the main center also had much of our meeting space, obviously the Clemens Room where the board meeting is held, the very large auditorium, and then we had various conference rooms and meeting spaces. This is just to give you an idea, and you have a handout, you should have a handout in front of you. This is what the space requirements are for each of the programs, and basically what was what we're trying to replace in our efforts to seek space to reestablish everybody. To give you an idea where everybody's been relocated, administration and finance and public information staff have all been relocated to the HR annex. Environmental health has been utilizing space over the 400 Shadow Lane office building, as well as the Henderson Public Health Center and the Spring Valley office. Nursing is also placed staff out of the East Las Vegas Public Health Center and Henderson Public Health Centers, also at 400 Shadow, and there's a small number of employees that are telecommuting that their work lends them to do that.
But telecommuting means they're working.
They're working, right, but basically they're working from home and have a method to be supervised and to check in as needed. Health cards, staff has been sent to East Las Vegas and Henderson Public Health Centers, as well as the Cambridge Community Center, mostly to supplement staff there. Although health cards, and when we talk about health cards, that also includes vital records. Vital records is being provided at the Henderson Public Health Center, where health cards is at East Las Vegas and Cambridge Community Center. IT staff is located at 700 Desert Lane. There already was IT staff located there, and so they're kind of doubling up. A few of the staff is also in telecommuting mode. And then security, that was the security staff that was located at Ravenholt, and also now with being officed at 700 Desert Lane. And then, as I mentioned, the one community health staffer that was in the Ravenholt, that they're located over at Shadow Lane with the remainder of the community health administrative staff there. In doing this, particularly for health cards, because that's where our cashiering function comes from, that they've added the cashiers to Spring Valley and 400 Shadow Lane offices now, because that's where services that rely on cashiering has been relocated, and health card administration is also located in the HR annex at this time. So kind of give you what we see as a long-range relocation objective. And basically, it's to refocus our efforts on attaining a facility that's basically large enough to house all the programs and staff that were at the Ravenholt Center, as well as those located in leased administrative office space. Again, not space that's not being used as service delivery sites, but also has the capacity to serve as a central service delivery site. And I think this, from the experiences, from what I hear from the team, that that with this event, that it's clear that central site is really critical in this community. That so many people do rely on it in this area. That's the long term. The short term, where we're at right now, is that what we are working towards is within the next 60 to 90 days. We are working towards relocating displaced staff and programs to available lease space until a permanent facility becomes available. So we have basically two options here that has presented ourselves in the past week for the short-term relocation. First is to relocate all the displaced program staff to the 330 South Valley View building on a short-term basis up to 12 months. And this comes out of that this is a building that we have assessed, that the Facilities Committee has identified as being one that is a good fit for the district, and we've been asked to do due diligence on, which we've done a good deal of that on there, as well as that the owners have expressed and actually have come forward with an offer to lease just the first floor space for us to meet our immediate needs and work out a favorable short-term lease up to 12 months. So there's several issues, things that that are positive with this. First of all, it's immediately available. It needs some cleaning up and maybe some reconfiguration. It already has a lot of modular furniture in there so that we would be able to use. It will allow us to reestablish the Ravenholt operations in a single central site, basically not too far from where we were located, to basically reestablish what was there. It would allow us to just make a single move instead of multiple moves, and that will allow us to see some operational efficiencies as a result of that. And if we were to occupy, then it allows us still some flexibility in the time to explore some long-term options as a replacement facility. And just one caveat is that it will require some build-out for clinical services space if we were to have everything there that we had over at Ravenholt. The second option is to basically relocate if something like the 330 couldn't work out where we had everybody in one site, then the second option would be relocate everybody to multiple lease facilities up to a 12-month period. And so there are various sites have already been identified in the community, and most are ready for occupancy within 2 to 6 weeks of signing an agreement. Through the City of Las Vegas, we've already identified a facility on 2300 East St. Louis that appears to be suitable for environmental health operations, and that is a very strong contender if something like the 330 Valley View building couldn't work out. There are several sites that are currently under consideration for nursing and administration, and our real estate team is here. They can talk more in detail about what some of those sites are. The downside of this is it will require multiple moves. So not only added expense, but also I think taxing on our IT staff, our facility staff, and so forth in doing that. And also there would be some operational inefficiencies because of the separation of programs and staff and being different places, as well as add additional sites that we'd have to maintain within the district. And similarly, clinical space is pretty much at a premium. So some of these spaces still may require some build out and be able to use as clinical space. So those are really, right now, the two main options that we're working on. There's several action items, and just to point out what needs to be done to get through all this. One, again, we continue to review, identify, and assess properties in the community. Once we do that, we have to negotiate the leases and to execute the leases. And again, we can do a lot in doing due diligence and negotiation favorable terms, but it will take having to bring those leases here to the board to approve those. If staff and I do not have the authority to do that. It will take some time to prepare spaces for occupancy, and in fact, and we'll get down a little bit on the bullets later, is that we'll need to also, since if we're not able to immediately get back into the Ravenholt to remove furniture and supplies and everything, we may have to also lease or buy furniture and or modulars to make some of these work, and so that would be an added expense. We'll have to contract with moving and relocation companies, and staff has already been working on identifying those, so we're ready to go when we have a site to move people into. Of course, we'll have to prepare staff for the relocation in terms of letting them know, where they're going to be relocated, the timelines, as well as certainly communicating to the community, where different programs can be found. And a big part is that we'll have to have a way to be able to remove supplies and equipment and furniture from the Ravenholt Public Health Center, in the current condition that it's in. And again, we'll have to work on developing an acceptable safety plan in order to do that. And then once we get through all that, then we'll be able to set up and resume operations in a new location. So that's where we're at this point in time, and as I said, our real estate team is here, as well as Jerry Boyd from Facilities, and we try to answer your questions.
Go ahead, Anita.
So for option one, what kind of cost are we looking at?
I'll ask Larry Singer to come up with associate.
Hi, good evening. I'm Larry Singer. I'm with Grubb & Ellis, and my associate Mike Tabik is here also. We've been talking to the owners of that facility. We don't have a firm number yet. We've suggested that it makes an awful lot of sense for them to give you, to charge you a very cheap rent while we try to negotiate a long-term transaction, a long-term solution to the issue here. With a caveat that if we don't come to an acceptable term in the long term, then you'll relocate to alternatives. There are alternative properties out there, and I want to make sure that it's clear that even though the focus of attention has been on one facility, certainly that's a real estate agent's nightmare to put that on public record, that there's only one facility. So I want to make it clear there are alternative facilities out there. And
do we have a ballpark figure?
We don't have a ballpark figure. We'll have a well, if I were to throw a ballpark figure out there, it would not sound appropriate. But the numbers that's been presented to me on a short-term basis, and the short-term would be about a year. I don't think it would make any sense financially to try to relocate for a short-term less than a year, because if you were going to solve your long-term needs, it's going to take you at least a year to get into a long-term occupancy situation. To do it for shorter than that, then you're just going to be back negotiating in a 6-month period or something like that. And of course, it would give a landlord a little bit more negotiating leverage if you have to go back to him. That being said, you're probably going to, a starting point would be somewhere in the $80,000 a month range.
80,000?
Yeah. Now that building is about 160,000 square feet. The rental rate, that would reflect a $1 a foot rental rate, even though you're only
okay. Well,
50. I'm sorry,
I have
50
to be
cents.
honest with the board. Here is my concern. We just went through this whole thing on the budget. We are now talking about, in order to, if we don't get the funding from the county, that we're going to have to start rating some of these funds. And here we are focusing on the CenturyLink building, which is what the dream has been, I guess, since before I came on board, and it seems to be the only place we ever look. I have talked to the city of North Las Vegas today. We have our old city hall, It is not quite as big as they need, but we're willing to allow them usage up to 2 years for free, maintaining obviously all the expenses that electricity and all of the maintenance and upkeep and all that you would be responsible for, but something really kind of similar to what the county has done in the past, and basically been told that we would rather spend $80,000 a month instead. So under the current economy and under the current economic situation of the health district, I'm just beside myself, so.
Commissioner Scow.
Well, I had a similar comment, because last Monday, we heard from the city that there was space, and I know that the county has offered space. I would like to see that we explore that more before we start talking about spending thousands of dollars a month. When the entity, and now to hear that North Las Vegas is offering their entire city hall. It's not as centrally located, which can be a problem, but we have availability among the entities that I think need to be explored.
And let me make that clear too. They are being explored. I've had dialogue with Representative of North Las Vegas, refresh my memory, Al Noyola, on both the new City Hall space, which would probably be a more efficient way to go than the old City Hall. We've spoken with Clark County Real Property Management. The property that they have available, the space they have available essentially is bits and pieces here and there, almost all of which is downtown. We've not heard anything about any availabilities in the county center, the Clark County Center. However, we do know that this is now, I believe Randy Tarr is now looking for some space. We were dealing with other people in Real Property Management. Randy's out of town for a couple of days, or a couple of weeks, I believe. I'm not sure when he gets back. Next week. And also exploring the possibility of free space with the city of Las Vegas. All that being said, again, what we're looking at is right, and again, we keep on coming back. I know we keep on coming back to the CenturyLink building, but we're looking at that as one move into the building while we try to negotiate a long-term solution to the issue.
Commissioner G.
Thank you. Yeah, that is kind of my same frustration. I think we also were looking at the Russell Building, which we have, it's a brand-new facility that we don't use because we had to lay off several hundred people in our building department. So I think all the local governments here can work to try to find a reasonable mechanism to assist them to have a place where they can distribute and serve the community while all this is going on. That said, every time the CenturyLink comes up, I just feel like I'm being boxed in, because once you get your proverbial nose in that tent, then it's going to be something that we're stuck with, and I don't think that decision has been made at this point. I think that no matter what happens, we have an opportunity, and nobody's really done an analysis in a while of what community-based programs should be and where they should be. We need a centralized administrative, absolutely, but there are programs, there's ways to assist businesses where we should be co-locating in some places, especially on business licensing and environmental health and some things along those lines. And this is our opportunity to really have a discussion of what community-based programs are out there, what would really feed business, and not just focus on something that since 2006, if I go back in the report, has been discussed, and here we are in 2012. Now, the other matter that has not been brought up tonight is the other court case. God, I hate when governments sue each other, but that's the way it is. The other court case is whether or not, part of the reason they're in the county building is because most of our other entities cannot own property. And that is our position, is that they cannot own property, and I think that's another court case that we have out there, isn't it, Annette?
Yes, and it's pending a decision right now with the district court.
Okay, so it's in district court.
Right.
And so, that's a whole nother factor. So as we move, we should move prudently to make sure we're getting the best location, the best bang for our buck, a good place for our employees to be able to work. But I'm going to go back again. I don't think the building is going to fall down on our heads. I don't think If I go back to '06, when P. Gal was first hired, there was nothing wrong, other than it wasn't large enough, it needed more money, the condition of the building is adequate, and now, granted, the diaphragm was never there, and all of a sudden, you can't go in and get your files? I'm sorry, I don't think that that's accurate. I think we're taking advantage of a circumstance to try to justify a means at some point. So we can agree to disagree on that, but I don't think tonight we have to make a decision on which option. But I do think that we've got quite a few more that are available out there, especially by working with our sister cities and the county as well for proper locations for places. And hopefully, as you meet with your real estate team, we should be talking to the managers of the various entities and say, you know what, if we've not asked this question other than, yes, we need a new facility, where should we be delivering services? And I think that's got to be a fundamental question that's answered, whether it's in Henderson, North Las Vegas, that way you might be able to get your clinic back. But that's a fundamental question a health district should be asking, is where do we deliver services? We should not expect people to have to get on a bus to come down and get a health card anymore. We should not expect a business to have to come to us. There are different ways to be doing it, and that's something we should be taking advantage of right now when we got the time. Thank you.
Question from Mr. Noonan.
I'd like to ask P. Gal, I want to follow up on the commissioner's comment because I think it's a good one. The issue of being able to go in and get our files. I mean, we until you all did the diaphragm study, which we asked you to do, the phase 2 study, we had no idea that the building, was in that bad a shape. There's got to be a way to kind of shore it up enough or find a firm that will do something, because I think not having the files, not having our equipment out of that building is a real inefficiency measure for the staff. So I think that's got to be one of the first questions that gets addressed. How are you going to get in there and get stuff out?
Correct. I think that was a recommendation from the City of Las Vegas Building Department, was to have a building safety engineer come in and define the parameters under which equipment would be taken out of the building. And I know the district is looking for an individual like that to give them that kind of advice.
And just to say is that, that we have as part of our, process here is that, we have through our process here has come up with, at least for an interim process, for procedures on a very limited basis, for people to make requests for priority items on an as-needed basis, so that that designated staff can go on a limited basis to go just get those items and move them out. But to do something massive, to move all the furniture and equipment and everything in a massive way right now, we'd want to get that safety engineer to be able to give us guidance in how to do that. But I mean, but we are allowing people to access it again on a very limited basis for basically mission critical items.
Mr. Mears.
Thank you, Mr. Chair. So I guess my understanding from our staff is that our inspection people declined to condemn the building at this point. They have hired a third-party engineering firm to come in and take another look at the building or something like that. Does that sound like what you heard?
Yeah. No, what was explained to me is that in this type of situation that generally they would hire, like I said, a third-party engineer to do an independent assessment. Since the district's already had one engineer to do that, and we've gotten that opinion from that engineer. For the city to be able to make that assessment, they would have to hire a third-party engineer and then also charge that cost to the district or to the owner of the building, basically.
Well,
so we haven't really. That's what I understand.
Bad news, commissioners.
Right.
Okay, thank you.
I don't.
Any other comment?
And I just want to say, again, reflecting, response to some of the comments is that, I mean, this is a very fluid situation. I mean, this is where we're, where we're at within, very, short time to be able to identify properties. Again, as far as the Valley View, it's, as I, put out there, it's immediately available. It doesn't, or let me put it this way, is that right now, I kind of agree, there's important for us to look at, as you say, where we should be. Right now, though, we have staff, kind of on top of each other in already, I say, in some areas, already congested, facilities, and that may be good for, people may be good for a week, may be good for 2 weeks, maybe even 3 weeks, but we have to relieve that congestion for folks also, so that also we can be more fully operational. Doesn't mean, even though we've relocated everybody and we have a plan for every program, doesn't mean that everybody's fully operational. And so our goal right now is how can we, relieve that, get people in a safe and functional location, and within the next 60, 90 days, and then be able to use that time to be able to ask the questions about, to do a more thorough, I would say, just look at what our options are, and identify, what, that plan needs to be going forward. But right now, we need to get staff into, facilities so that they can be fully operational.
So is the real estate evaluation including looking at the governmental jurisdictions, or just looking at the private owner?
No, we've taken a pretty thorough look of the entire valley, actually, just as we did for the main search for the replacement facility. And I don't think a definitive decision has been made to keep everything together. I think it's a preferred decision just because of economy of scales, because you don't have to move in 2 or 3 times. I think the first goal, and we're currently doing that, is to satisfy the medical/clinical needs. So we've been conducting inspection tours with staff on medical facilities that can be moved into, that are plug and play, that can get us right into, so we can get the clinical and the medical working as quickly as possible. The second part of that is to establish where we're going to go as far as the administrative staff is. Yes, we've looked at a lot of, well, we haven't looked at any of them yet, but we've investigated units of space from office space from 20,000 square feet up that will allow us to separate different locations into different areas. We will start those inspections, shortly. We have to first, as I said, secure the clinical space. Also, we have spoken to all of the entities. I did hear something prior about the Russell Road facility, but I don't know exactly where that's at. And of course, as I said, the city. I have to tell you, the old City Hall is not in very good shape. I don't know when the last time you were through there was, but that's something that has to be considered as well. If the new City Hall space was offered at I mean, we were also told essentially $1 a foot at that facility too. So
well, I think that no one is looking at the old City Hall as being anything more than a 2-year solution. I mean, the building was perfectly adequate. We were in there for a very long time, and the building is fine. Certainly does not have the issues that the Ravenhall building has. And no, I don't think that anyone's looking at it as a long-term solution, but I do think until we get court cases solved, until we know exactly what our budget is, that free is not something I would slough off at too much. And certainly for, I mean, there is some room in the new City Hall. There's certainly a floor or so that's available, and that certainly would come as more of a leasing situation, and we're more than happy to look at that alternative as well, and it still would keep you relatively together. I mean, you'd just be across the street. If there was some admin services that wanted to go in the new City Hall, that'd be fine too. But to kind of not look at all the options is where I have a problem, and particularly when some of them are low-cost or no-cost options, except for possibly the same expenses that you're going to have no matter where we relocate to. That's where I have a problem. And no offense, I understand the centrally located thing, but I'm looking at what you've got here, and everything I see is south and southeast. The North and Northwest has no representation from the health district. And it's about time we get something to the North, to have some services. I mean, you know, you talk about health cards. Well, heck, if you're a North Las Vegas business, because there's nowhere anywhere near us. And especially now that Ravenholtz is down, we're traveling quite a ways to go get a business card, a health card, to go and get any kind of clinical service, to go get, I mean, this is an opportunity to look at options, I think, on the north side, both in the northern part of Las Vegas and the northwest part of Las Vegas and North Las Vegas, to start providing services that are not just quite to the Henderson and to the south. I mean, when you look here, we managed to have Spring Mountain, Henderson, Lake Mead, Shadow Lane, everything is very centrally located into the south of it. But what about the north? We need services too, and I think this might be a way to improve that situation.
And again, you know, we have been looking at all those properties. In fact, you know, the one that we identified that would be a good fit for, you know, for environmental health is one that is basically essentially a very low cost, almost no cost. It's a state building that the city of Las Vegas has an interlocal with the state to occupy, and as long as it's occupied by, you know, for a public purpose, then they can use that, and they've offered that to us, and they, you know, it's a nominal rent of $1 a month, so which is, you know, very affordable, and it has some features there that would be very workable and appropriate for the kind of operations that environmental health, you know, needs to support. But again, we haven't, you know, talking with the city of North Las Vegas. I think we just need a proposal of something, and you know, and I'd be glad to go, you know, work with the team to get over and relook at that. And also, we looked at the Russell Road, the Development Services, you know, facility on Russell Road that the county has, and it's a very nice facility. It's, you know, great, it's good space. The thing is that, you know, when they came to show it to us, when we went out to look at it, it wasn't quite clear. You know, there was space, but it was kind of patchy, and even though they can consolidate, so we have still been engaged in communicating with them about that, so we can have a better idea of, you know, what kind of square footage can we get that would be, you know, contiguous enough that, you know, we can, you know, and we're also exchanging information for them so they can see what they can do to create space that would be acceptable. The other part is that we still would need to talk about what the terms are, and that, you know, that part we haven't gotten to yet.
Question from Commissioner G.
Thank you. Could you just maybe get to the board, this is a nice document, but it's not there's no plan yet that's been presented to the board other than just more talking about it. You have a list here, for example, nursing division, 17,291 square feet. That's for all 85 employees, correct? Am I reading that correctly?
I don't have that in front of me.
Okay. It says auxiliary team, maternal child health, HIV,
Right.
AIDS, immunizations, and so forth.
Right.
It would be helpful to see how many offices currently or square footage currently each of these are using, so as we hear you say, this is too chopped up or that's not going to work, that we at least have a better idea in our mind. And then secondly, as you look at those maternal child health immunizations, are there places in the community, we've got 4 places currently, are there more that we could add to that in order to be doing a true community-based program? So and then finally, just let's not forget that we're also supposed to be participating with the School of Med and the
Right.
and UMC on a medical corridor, medical needs where the health district could fit into something along those lines too. And so we shouldn't, in a rush, forget that we might want to partner up somehow in some of that too. Thank you, Mr. Chair.
Right. Yeah. Well, and again, what we have here on the PowerPoint was intended to present you with that plan. The other on the square foot, I believe this, you know, there is square footage listed for each of those programs. I was hoping that, just as you said, Commissioner, to, you know, be able to use that so we can identify specifically how much square feet each of those programs require, you know, to operate. And that's also making the assumption that that space they occupy was actually sufficient for them. That's not always the case. And the maternal child health, just also be aware that many of those, would also be, our outreach basically they're on the field, so they're already community-based, and so they just, basically need a home base to work out of in most cases. I don't know if Bonnie, you had anything you wanted to add to that? Was that accurate? Okay, that's fine. So.
All right, so, I mean, in the interim, the plan of action is, in a sense, nothing more for the board before our next board meeting, or something may be coming on a quick basis that we'll need to get together to discuss?
Right. Well, I think we'd like to be able to start setting, congealing these plans and to move, have something to move forward for, if not one large location that we can move everybody to begin, to begin nailing down, where different areas can be relocated between, the different properties, the different, jurisdictions or different properties, private properties that might be in the community. And basically my goal is, have a plan for each of those areas so that so they, know where their options are. And we have some good options already, congealing for nursing, for clinical space. There's a couple that have been identified that they believe can work for them, and it just requires, I guess, finding out what the terms would be. And like I said, we identified the one for environmental health, and there are some plans also in place to do some of those partnerships that we talked about, with some of the folks at UMC and other partners.
And so as of today, everybody is working and every program is being presented in some form or another at some location?
Generally, I think virtually almost maybe, except for maybe one or two people, and we're still trying to verify that, have reported to work today. The programs, there are services available in the sites you see. It's not necessarily optimal. There's some areas that are not still fully operational, that we're still not seeing the number of people that we normally would see for different programs. If we had Ravenholt operational, and some activities had to be suspended in order to be able to accommodate some of the other services.
Any other comments? We'll go ahead and close that item. And that is the end of report, discussion, and action. Next item is board reports. Any items from any board members? Oh, I'm sorry. Getting ahead of myself here. Item number 6, we're not done. Discuss and consider authorizing the Chief Health Officer and the Interim Director of Administration to negotiate and enter contracts for lease space as needed to address the district's facility and operational needs. And I think we have a document in front of us, is that?
No, I printed it out now. I thought it was posted, but it wasn't.
Okay.
So I to print out the
Thank you. So I know we had this similar item at our emergency meeting, and Member Woodbury brought up some considerations, and I think that you went back and worked on that a bit. Do we need to read this into the record or any such thing? Or you've got it, that you can put it into the record?
I have one left. That doesn't mean we don't have a quorum, does it?
I think we have a quorum, though. 7, 1, 2. We got a quorum. So once you've had a chance to review, any comments or questions? Chris?
Thank you. Based on the last conversation, why would we authorize anybody to negotiate and enter into contracts for lease space until we actually know what the plan is and who they've reached out to within the governments that may not cost them anything? I'd like to know where we've located folks. Are they paying anything? Where's the budget? And none of that has been addressed before we just say, yeah, go out and bring it back to the board and negotiate. Because once they're, I just think it's premature at this point.
I think one process of thinking was that if there was something that was available and it had to be acted on quickly, I don't know that as things have settled down a bit, if that is actually an issue that needs to be addressed. It seems like maybe there's enough time to address things as they come forward.
I personally would like to see a plan and the budget that goes along with it and what the anticipated cost. This is somewhat premature. If something comes available, we can call a special meeting if that's what needs to take place.
If we did have a real estate deal that needed to get approval, would that take a quorum to approve it?
Yes.
Could it be done by phone, or would it have to be by public notice?
Yes. You can do phone, but you got to post it.
Right. I don't believe our bylaws preclude doing it electronically. I'm not sure that they specifically mention it. But as long as you got a quorum, I don't know that having some electronically versus in person, as long as you've got the quorum, I think you would meet the open meeting law.
So if, for instance, North Las Vegas had something available next week and we had to make a decision next week, that could be done as a telephone conference?
We could do it that way and have, when we do the meeting notice, just make sure that the public is aware of where they can come to participate in the meeting. Because we would still need to have the public comment period and the materials available for them.
So would that seem to get us to where we want to be in order to have quick response when a great deal comes up?
The, just in addition to that, the special meeting, the only meetings that do not require the notice requirements for open meeting law are the emergency meetings. Special meetings will still require that 3 working day notice.
And I don't know that anybody can perceive of a scenario that wouldn't allow itself 3 days to take care of business. Anyway, so that said, I guess we have a item in front of us. Anybody wishing to?
So this item dies for lack of a motion in Kirsten's opinion.
So if nobody wishes to make a motion, that's what we'll do.
Item dies for lack of a motion.
All right, so be it. So if and when any kind of a good prospect comes available, we'll handle it as a special meeting.
Could we just consolidate Romanets 2 and 3 and give authority to negotiate and sign letters of intent or memoranda of understanding subject to board approval, at least so that they can move down that road? So everything would be subject to board approval.
With no disrespect, wouldn't it be anyway? And so what's the purpose of giving them authority to sign or enter into something if it still has to come back to us?
Well, I guess we don't necessarily have to do a petition, but we ought to at least give them some directive as to what they can and can't do. It seems counterproductive that they're just sort of stuck in limbo, not knowing where to go.
And I appreciate that. That's why I asked for a plan. I went through the endoscopy issue, and it took forever to get an actual plan on how you get people phased out, who gets records, all that part of it. And I think we need to know what's wrong with what we have located currently. Is it a problem? What are we trying to fix right now then? Because I don't know which departments still need to be someplace, or do they have the satellite spaces for 60 to 90 days? I don't know. I can't tell that from the documentation that they gave. So before telling somebody, oh yeah, just go ahead and enter into an agreement, I'll tell you it'll come back. It'll be the Embark CenturyLink building.
Okay.
Any other comments? If not, we will let it rest.
My only comment is I don't want to micromanage the process, so I don't want to be called for a special meeting every 2 weeks, so, or even every other week. It's just, at some point, we got to turn it over to them. So I don't disagree that let's get a plan in place, but let's do it quickly, and then let's give them authority, and let's get out of the business of making every decision on the micro level.
I would concur, and again, I guess we'll let the item rest. All right, so that is the end of Section 5, and we'll move on to Section 6, Board Reports. Any board members having any items they wish to bring forward? I think I can bring forward the issue that we will conduct the annual Chief Health Officer Annual Evaluation coming forward, and I would chair that committee. So I would ask Shelley to go ahead and send out a request for volunteers to participate on that. Let me know before the end of the day on the 30th of April that you would like to be a participant. And just as in the past, we'll make sure that there are at least 2 elected officials and 2 or more appointed officials. So it could be as many as 3 elected and 2 appointed, or 3 and 2, whatever works. So let me know if you'd like to participate on that annual review. We'll get the committee operating. All right. And anything else from health officer and staff reports?
Not at this time, at this late hour. Thank you.
Very good. That's the right answer. No other informational items, so I think at this point we could go to the last item of public comment. Any members of the public wishing to make comment to the board? Seeing none, we'll close that, and I'll take a motion for adjournment. And we're adjourned. Thank you. What do we have in place for May meeting then? Here, or yet to be